you, Amy. You'll go ahead and call the roll.
Dr. Jones,
Here.
Kathy Emanuel, David Thies,
Here.
Dr. Peterson,
Here.
Dr. Goodley, Dr. Sharman, Dr. Reichstack,
Here.
Dr. Sander, and Beth Benich-Thurna.
Thank you very much. That takes us to our next agenda item, which is approval of this evening's agenda. Are there any additions, comments on the agenda?
I would like to make an addition about
Yes.
bringing the Article 5 for the town board, the county health board entry into the. I brought it before the board, not talked about it.
Yeah, okay.
Can't
So,
remember what it's
yeah.
So it was.
When do we do that? Can we do that with correspondence and communications?
Your stuff.
And add it,
Oh, yes, no.
add it there? Is everyone okay with that? Adding, talking about Article 5 there?
They put under other business.
Or other business, you want other business? Okay. Okay, we can start, yeah, we can start with other business. I add it up there. Any other comments? No, you
I
completely understand. Entertain a motion to approve. Moved and seconded. All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. That moves us to approval of the minutes from our March 11th meeting. So you have those before you in items 1 through 3. I'll entertain a motion to approve the minutes.
Move approval.
Do I have a second?
Second.
Moved and seconded. Any discussion on the minutes?
Thought they were pretty good minutes.
You did an amazing job. We are very, very lucky, very fortunate. All those in favor? Aye. Anyone opposed? Any abstentions? Thank you. And then we have a line item for public participation on our agenda items. Is there any public participation on agenda items?
Seeing no public.
Always asking. Thank you for always attending. We appreciate it. That takes us to correspondence and communications. And if you want, now that we have other people here, would you please do another introduction for all of us?
This is Mamadou Tankara. He is our new deputy administrator at CPHD. He just started last Monday. He comes to us from Utah, and his wife and daughter will join our community in August when she's done teaching out there, so, or where their contract ends. So he is here, he is learning the community, and I'll be dragging him everywhere all the time with me. So I am an MSW MPH. He is an MSW MPH MD. He is not only smarter than me, but he's also younger than me and able to use all of the electronic things. So we're moving in the right direction.
Julie, it's increasingly easy to be younger than you.
It is increasingly. It is increasingly. That is true. I'll be back.
Oh, it's a lot easier to be younger than me.
Okay.
Well, welcome to the community. We're very happy to have you here.
Yes. I hope you like humidity.
Did you want to say anything about anything so far?
I'm happy to be here and learning about the community and getting to know all of you.
Okay. You'll be seeing a lot of them.
We look forward to it. Thank you. Any additional correspondence or communication that you have to do?
No. I did get something from NACHO today, which we're looking at this afternoon. I can send that out to everybody. It is just weird. I mean, they're cutting things that I don't understand why on earth we would cut that, and doing away with entire departments and doing away with all the experts. So nothing good coming out of the federal government on the stuff we watch anyway so far. So we still, right now, we only have 2 grants that we know that have been cut, but we just have no idea. We have no idea what's
Which
coming.
2 are those?
It is, what is it, Whitney? What are the 2 that are cut? The one is adolescent health and well woman?
Adolescent health and well woman.
So, you know, working with adolescents to help them
Navigate
navigate the healthcare system, which is really important. And then also the well woman, which is, you know, getting women that aren't getting them in for the preventative health screenings, which apparently, from the looks of things, we're gonna do away with prevention. We're just gonna opt for.
Well, and then
Supplements
if you
for exercise.
need services with Medicaid, you won't get those either.
You won't get
Right.
those either. And what probably, I mean, I'm sure you guys have probably already heard what's going on with like the COVID vaccine and the canceling the contract for H5N1 vaccines, which, that terrifies me because even though we know what to do with the pandemic, we can't create our own vaccines. And nobody's gonna create them for free, so, well, other countries are creating them. But it's concerning, because I don't know, and I've never not been able to go to the CDC and look at their information and trust it. We don't trust it right now. We literally cannot trust what's on there because it's nutty. And so we're going through our own web pages and taking down links that are connected to things that are not real. The one good thing that's kind of behind the scenes is that the Advisory Committee on Immunization Practices, ACIP, it has been reassembled
Oh,
at CIDRAP, which is at the University of Minnesota. They're all reassembled. I'm sure it's all virtual, but they're still a part of that. What they do is look at all of the data that comes in regarding safety and efficacy of vaccines for our country. They make the recommendations, and even though they'll make the recommendations that we'll trust, insurance companies won't have to pay for them if it doesn't come from the federal government, which I suppose is the point. So we're gonna see a lot less vaccinations. And one of the weird things, I'm sure your head about popped on this one, when they suggested that kids and, pregnant women don't need, well, pregnant women are a high-risk category already, that just by very nature of being pregnant. So it's
because our baby is
confusing.
under 6 months.
So it's gonna be, I don't know, it's gonna be concerning.
No, yeah, kids don't get super sick with COVID, but
Mhm.
the new data that trickles in all the time tells us that the risk isn't 0 for long-term consequences.
Mhm.
So,
And
it's
kids
like you said,
kids are vectors, you
Yeah,
know, they
yeah.
bring them into the
Mhm.
home where the pregnant women or the grandparent or the person with a,
Mhm. And it's like you said, it's like slashing prevention, which everyone that's ever even taken a month of medical school knows that prevention is always going to be preferable. So, but, you know,
it's,
that we're preaching to the choir in this room.
One thing, you kind of mentioned about this, but I've been also hearing that because of the dysfunction within like the CDC and everything else, that there like certain public health departments haven't gotten guidance on certain things. Like what are the impacts that we're experiencing in terms of lack of like access to information?
well, I mean, some of the health departments that are bigger, like we know where to go and get the information. We have staff and we have enough people to reach out to get that information. A lot of places simply don't. I mean, some of these health departments have 5 people in it. There's no way that they're gonna be linking into all this stuff and trying to figure out what to do. We're also in Illinois where the state health department is doing, a great job. But in these other states, I don't know. I don't know. We have 2 states now that are completely free from fluoride in their water, which is also concerning, especially for, kids. It's just, I don't know. I don't know where it's gonna go.
It's good to hear that the ACIP is
It is,
reassembled.
yep.
Because then we can go for recommendations. The problem is then it does not, the ACIP advises the CDC and the FDA, they still have to approve like new vaccines
Yep.
and the vaccine schedule. We can
Yep.
get a vaccine schedule from the ACIP,
Yep.
But I think it will take knowledge of like the, boots on the ground to know, okay, I can't believe CDC, I have to go to the AAP.
Right.
Or the,
Right, and that's, and certain states like Illinois will make sure that that is going right through IDPH and getting right to the forefront. But I can't help but worry about other places, because it's not like we have some kind of magic bubble over Illinois.
Right.
And, and H5N1 is still scaring me, and.
And they've gone dark on it.
And they've gone dark on it, that's right. We have supposedly had no cases in the last 4 months. That's just not true. But that's scary, because where are they? Well, we probably know where they are. They're the people working on the dairy farms and in the chicken houses and things like that. And they're just not being, it's just not being addressed.
Is
So-
it that they're getting data from the states and not reporting it, or is it at this point the states aren't even?
They're not collecting it, is my understanding. They're not testing, so, if you get sick, it's kind of like, cat deaths. I always use that as an example. And we know in our community, we have tularemia, and we know because we have cat deaths. And in this community, people will get necropsy done on their pets. It doesn't happen in most places. So, we see more here than a lot of places. And now the whole country is going, we don't even know, we don't know what's out there, which is just it's so weird. We're used to hearing a lot more stuff. Certain, obviously states still communicate, and we still hear reportable diseases and things like that, but it's just, I don't even know. It's just a whole different world.
Yeah, I think in Utah, one of the funding that supported community health workers to go and test those farmers in the rural areas got cut.
Mhm.
So for H1N5, so now there's no reporting, there's no collecting, because
Yeah.
there are not people in the ground collecting those data. So even though there might be cases, and in most places it's people who are undocumented that work on those areas, so it's really difficult for them to come to hospital to be tested or collecting the data. So that's the challenge. So
With that virus, at least up to the point where we could get information on it, it wasn't in my mind a question of if, it was a question of when.
I think everybody's.
Pretty much, yeah. And the thing is, every time it transmits between people, and they're not giving the PPE and not giving the education and stuff like that, every time it transmits between people, of course, it's mutating. And every time it gets in another animal, it's mutating. And it's just, we're
If it
not,
gets in with somebody with the regular flu,
or pigs, which is
Yeah.
coming.
yeah.
And then what? Because we knew with every other thing, we know what. We know we can get up there and have vaccines, ready and stockpiled.
And there's no leadership, there's just
I know,
like,
it's
dysfunctional,
it's
gutted
literally
out.
terrifying.
It's terrifying, and also, one thing that I was like hearing is like, I don't know to what extent people are like starting to lose access to medications and stuff like that. If we're starting to see stuff like that.
Well, I heard today that ivermectin is now made over the counter.
I know,
So
right?
yeah,
It's like-
I know.
I saw it, it's like so ridiculous.
I know.
I just am like, okay, what? Talk about quackery gone mainstream.
But the good thing about that is that pharmacists, they're
Yeah.
refusing to.
They're
go
they're
there.
making
So they're
people
like,
have a doctor's
yes,
note,
But
but
it's
they-
like online,
Yeah.
I'm sure, like, and these,
yeah.
Yeah.
I wasn't aware we were having a worm outbreak in the country.
I know.
We're going to, that's
There's a
right.
bunch of
That's
worms
right, we're
in the
going
end,
to.
the
We're
brain
just all
up there,
going to
yeah.
when you start getting from the pigs and
Yeah.
stuff again. Ugh. Hookworm will come back roaring back.
Everybody gets brainworm.
Well, then they'll be resistant to ivermectin,
I
because
know.
everybody's taking it for their
Yeah.
viruses.
right.
Exactly. Wow, that's a scary thought too, so. I don't know, we're in uncharted territory. Every day is a
Yeah.
new adventure. That's all I can tell you. It's just,
What about our local, like, health resources? Like, if, let's just say, for instance, right, with Medicaid not getting funded, that's like, now the state of Illinois will have to take that, and I don't know if we can or not, right?
I don't.
It probably, there's gonna probably be
There's
some
gonna be
fallout.
cuts.
But then how many other agencies would be affected by this, and how do we, you know, something I think about is like, at least on the development disability boards, we have every time we meet is like response to emerging threats. And I feel like we almost need to start doing that because I don't know what's gonna happen. I genuinely don't know. As a provider, you know, it's like, what will happen to people?
I mean, we have, you know, the federally qualified health center, Francis Nelson, or Promise Healthcare. We have, you know, but if they lose Medicaid, and we're gonna lose hospitals, we're gonna lose whole hospitals and whole healthcare systems.
Right.
Because they can't do it. And interestingly enough, the red states are gonna be super surprised when they realize how much of their hospitals are supported by that.
The whole South.
No,
The
it's
whole South.
Medicaid only
It's a
applies
stroke
to
belt,
inner
it's every
city.
belt because
Right.
it's
Slums.
Right, that's the bizarreness of it, but the people doing the work know better, and so why are they doing it? I don't understand, but anyway, I won't get yammering about that too much, but the thing is, it won't be good. I mean, we saw so much good come out of the expansion of Medicaid, I can't even tell you, and we're gonna see that all go back, and plus, people will just be scared to get. And let me give you a little heads up that right now, we have 7 active TB cases in this
Wow.
county. 7.
Wow.
Never have we seen this.
Are they
they
folks that
unrelated?
come into the university or?
I don't know the details on them, but I know that 7, I've never even heard of such a thing. And with the 7 will come just massive amounts of latent TB infection. And then we try to get that treated, but that's a lot of.
And the people, we haven't seen it very much, even as physicians haven't seen it very much. It's one of the largest killers in the country, in the globe.
World, yeah, it is. There's a new book out called, it's by John Green. I just read it. What is it called? Everything is Tuberculosis. It's actually a good little book. And it could have been pretty much eliminated. Same thing, with what's happening with HIV/AIDS is making, not to be political, but one of the good things that President Bush too did that I did like was PEPFAR and all the amazing, that's estimated to have saved 26 million lives, and now that's gone. And so what happens when you have HIV doctors and you stop taking your medication? Then we can start the HIV epidemic all over again with a new drug-resistant strain.
It's like one of the most incredible stories of how we fix something so quickly to like, this is like the height of stupidity.
And we're getting ready to get to 0, and they're making like huge strides in like gene editing and getting rid of HIV, which is I can't even get my mind around it hardly. And we have PrEP and we have all this stuff, and it's going to be gone right when we were like that close.
Yeah, one item that I've seen in the funding is that they are moving all the funding that they're cutting from public health, so they're moving that into make American healthier again, like that.
Oh God, yeah.
Make America healthy again, right?
Yes,
Swim in the
that's
Potomac or
yes,
something.
that's the pattern that I'm seeing.
All the supplements,
I'm like,
supplements and things like that.
So like they're very
Quackery.
money-focused,
Yeah.
unregulated. I mean, they're probably good, and I mean,
No,
like
they're
I love
totally
this.
unregulated.
Yeah, it's, and that's the thing. I do believe funding should go for natural, complementary medicine research, right?
Of
I
course.
think that was like the expansion of that with the NIH was beautiful, but like,
Yeah.
this is like just money grab. Like
It is.
greed.
It's just.
So what do we do if there is some major, a lot of this is an unknown, right? The bill has to still go through the Senate and stuff like that, but if we start to have shutdowns of hospitals, like, at what point do we preempt, do we work with, here it's like Carl and OSF and Christie.
OSF is going to be a behavioral health hospital.
Yeah.
They're losing their ER, they're losing their.
They're keeping
The one here.
Keeping
right?
the ER, and they're keeping 25
One here,
inpatient
yeah.
beds, but they're opening up they're opening
There's
up
been some additional.
10 more
services
beds
last time I
in
saw.
mental health.
Wait, they're having how many beds?
You're gonna have 25 inpatient medical beds,
Eek!
from, they're licensed for 275.
Oh, God.
But they haven't filled them lately after they broke from Christie. But the announcement was that they're gonna expand their mental health capacity from 30 to 40. Renovate 2 surgical floors for mental health. Keep 25 inpatient beds. You can't run an ER without an inpatient bed, so.
Yeah.
But their ER isn't paying for itself anywhere close to it. They need a break even of 30 patients a day, and they're not getting that. So they're gonna move all their clinical outpatient work somewhere else, which somewhere else is gonna be either Danville or Bloomington.
Danville, I think, is what
So,
we're gonna try to do.
A lot of people aren't gonna follow that.
Absolutely not.
Are they gonna at least hire more psychiatrists and therapists, because there is
That
a
they didn't
lack.
mention, by the way.
That is one of the biggest frustrations I have, is I can't get anybody to see a psychiatrist or a therapist.
Well, this is a psych desert, even with the residency program.
Yeah.
Still
I
a psych
suggest
desert.
going back and watching the old institution movies.
Yes.
That's probably where we're headed again. I mean, everything is cyclical, or it is, cyclical. We always come back around to the insanity, but my God, I mean, so what do? I don't know. I keep listening to APHA, and, we're sending people to the to 3 people to the APHA conference this year, including Whitney, to go there and spread out and pick brains and commiserate and do whatever. We'll probably be protesting at that one too. Do all the things and come back with stuff.
Well, if you can, try to attend the Trump military parade.
Oh, yeah. Waste of time. Just the whole thing, it's just, and
Or the military parade in Los Angeles.
for that, really,
Think about
like, short
100
your
and-
own production if you're gonna start something unnecessary like that, like.
That amount of money could be, that amount of money could be.
But it's frustrating.
$170 million. But they're putting out the roadways.
It's probably about what the
How much are they gonna have
food
to pay to
program.
repair the streets after those?
Yeah.
Yeah.
16
The food
million.
program to a military parade.
Yeah.
Yeah, I mean, so anyway, I wish I had some kind of good news, but I really don't. The only good thing is that what we do here, when we've been through rough times, we've never been anything quite like this, but I do know that the foundations will start stepping up and leaning in with money. They're already doing it, so, hopefully, I saw that the libraries are getting help from Carnegie Foundation. And, so they'll start pushing out more money. They did in the first Trump thing, but it just didn't go off the rails like this. So it was able to be, and then COVID hit. So, but there's not enough foundation money in the world to take care of all this. Not enough. Not enough to run the infrastructure of just communicable diseases alone.
Right.
Just health departments all over, and the gaps and the holes we'll have in any type of just communicable diseases alone just is frightening.
Yeah.
We're gonna end up, I think, probably with like drug-resistant gonorrhea spreading more, which is scary. Syphilis is roaring right back, and the less access you have to health care, the more that's gonna come back. HIV, everything. It's just, it's sad.
But the good news is, there's us, right?
Yeah.
So the end,
Yes.
there's,
Yes.
college nursing, college medicine,
Yes.
McKinley, there's
Yeah,
health
and
department,
we're
we've got resources.
always, we're in a better spot than most in this
Yeah.
community. I say that all the time. But it's really hard not to look beyond our community. I'm trying not to so much, because there's not a whole hell of a lot we can do, but I do know that the partnerships and stuff, will click in, but it's just, now.
Have you been reaching out to like CIDRAC or others? Have we set up like an alternate route for getting this information
Oh,
out?
yeah.
As
It's
opposed to the CDC?
It's all out there. They're making it quite available. But again, the real thing is that the way it's set up is that if you don't have that from the federal advisory committee.
Yeah, because the insurance company.
Insurance companies can say, no, we're not
So
doing it.
I know they passed a law in Illinois that said you had to cover transgender healthcare if you wanted to be an insurance company in the state of Illinois. Is there not a way they could say you have to follow the recommendations of the CIDRAC?
Yeah, Illinois could do that, certainly. But, I think, around here anyway, that's what they're gonna do anyway. They're not gonna just like say, oh, we're not gonna do these vaccines, but all
Not just
the-
like getting the insurance covered.
Yeah, well, yeah, they could probably do that, yeah.
Because I feel like that would probably be something law enforcement.
Yeah, that would be, yeah, they can do that. Not with Medicaid, but they could, it's state part of it, I guess.
Well, then insurance companies also, I mean, I have no loss with them, but like, I think that they're also getting hit too in many different ways. And so like, it wouldn't surprise me if Blue Cross Blue Shield would try to take a hard line, that downtown office building doesn't pay for itself, But that's,
But at the
this
same
is like,
time,
it's
they're
very
not
scary.
covering vaccines, they're covering everybody getting sick, and they're covering the hospital stays, and they're covering.
Which, one
treatment
would think that
medication.
somebody would figure that out early on. I mean, that's.
Right, and
The math should not be that difficult.
It shouldn't be, and it isn't. I mean, ACA, that was the whole point of it. That was all the stuff that was put into place. It was all about prevention, every single thing. And it was working.
Mhm.
And we could compare ourselves to states that didn't expand and see the difference, lots of difference. But
Thank you, everyone, for a good discussion. Thank
For
you,
that.
Julie.
We forgot about
In
the
the right
rendering
area.
from all the cutting of the medical research and.
that we're gonna experience what Nazi Germany experienced. We're gonna lose all the research for
Yep.
a generation. So we're gonna lose all the
Yeah.
researchers. We're gonna lose we're gonna lose our place
Yeah.
in the world. I mean, the CDC was the premier agency in the world.
Yeah.
And there is a lot of international recruitment for our talent. I can just tell you on the nursing side.
Oh, yeah, Canada already has offered like.
Oh,
Yeah, I was gonna say, I got
Ireland,
something from Canada and I
UK.
got a
Really?
phone call and I had to say,
Oh.
I'm like, look, first of all, I know I'm a health department administrator, I'm not a physician. Well, that's okay. And I'm like, and I'm 60. And they're like, oh, well, you'll get points knocked off for that. I'm like, I'm not. Thanks. But I was
Should I have
like,
studied harder for my age?
right, I was like, stop
Already had your points knocked off.
Stop calling me, you don't need an administrator up there, you're fine. That's not gonna help you. But they are, obviously, everybody's recruiting from all over. And my friends that work at the CDC say that they're getting just,
They're getting inundated.
yeah, they're still being paid. So there is no cost savings, all these people were
Yeah.
booted out of their office, they're all still being paid at least through September. And all of their retirement and everything, like, it's actually costing
Yes.
so much money.
Yeah.
So it just makes no sense.
And wasn't there a legal challenge to some of the Dodge cuts?
A lot of them.
Oh, yeah, a
All
lot.
right, so, and so that's, at the end of the day, it's like, I'm not too sure how much of this is actually legal. I would say that the Constitution has been thrown out.
Yeah, and even if they
Well-
come in now
Congress.
and do it, it's gonna be hard, because a lot of people
It's hard to
aren't gonna
reassemble
take
that.
other jobs.
Yeah, people
Yeah.
are taking
Yeah.
it.
No, they've got contractors working, we just had, like, our NSF access was all screwed up because they decided to give us, like, 6 hours warning that they were gonna update the SSO stuff. And so we were getting calls on Monday about how people couldn't access their grants and everything because they decided to roll this out, like, 4:30 on Thursday. We're like, yeah, we're gonna roll this out by 5 o'clock Friday, and then you should have the changes done by Saturday at noon. It's just,
Wow.
It's, no.
Well, on
I
another
appreciate
note,
us talking
We're
about
all,
Yeah.
these
Yeah.
things.
we're all in this together.
Local government is what makes changes. I was thinking about that. This is like, this is so important. Hopefully, people start to realize, because we look at a dysfunctional government where there's nothing to be done, and the judiciary is probably the last hope, but I have no hope anymore.
I think what's good to hang on to is to look back at the earliest days of COVID here. And how, when we saw the rising tide, everybody linked arms and got to work. And so here, at least, I feel good about, our ability to respond and be that safety net as a community. Until which point we get overwhelmed.
Yeah.
But, the best relationships are created when you're in the trenches, getting stuff done with people. So I think that's a positive thing for us, and living in a state we live in. But I do worry about the grand scheme of things.
Oh, yeah, the major progress that's being made is gonna be, we can't replace it.
Spend more money for AI.
Yeah.
Our next agenda item is Smile Healthy. We have 3 monthly reports, February, March, and April. Those are items 4 through 9. I would entertain a motion to approve those as one package, unless anyone would like to separate those out.
I'll
Moved
move.
and seconded. Moved and seconded. Any discussion on those reports?
Yeah, I'd like, we have somebody from.
No.
Wow.
No, Esther's with, she's with finance from our humanities.
Okay.
But
All right, I'm
I want
looking
you to
at
look at the
recruitment
numbers.
reports, so I was trying to get a, kind of a bottom line on recruitment.
So I did ask, when we get to the budgetary items that they've requested,
Yeah.
I did ask for some of that information. And I think that was also included in the packet materials.
Yes.
To talk about what they're spending the funds that we have provided on. Is that what you mean, like for the dental?
Yeah, well,
hygienic
each
report?
one of these, each one of the reports has a discussion of recruitment or staffing levels, and it really seemed like it was whack-a-mole in many ways.
Well, can you go back one page real quick, Amy? I just want you guys to make sure you're looking at the numbers and the zip codes. Because again, you know, you're paying for county kids and the first 3, and even Savoy, because the Savoy kids go to school here, so they're allowed in the program, but there are 4 of them. I mean, these are almost all, with the exception of Rantoul, pretty much, it's all Champaign-Urbana kids.
Well, served outside Champaign, 28%. What that, we didn't used to have that figure.
Well, yeah. So, yeah, 105 out of 171.
Right.
Well, except for Savoy is, like I said,
Technically outside.
technically they're outside, but because they go to the school they use, and these are kids. So, anyway, that's just something to think about.
Well,
because
we've talked about
we're in a
that.
problem here, though. We are having trouble hiring hygienists. We just upped it a lot. We're now at $35 an hour for hygienists. We would like to hire 3. We're gonna start with 2, but we can't, you know, you have to have the hygienist. We have the dentist,
Yeah.
but now you have to have them.
Well, they're saying that they've been having to use their dentist to do some of that work, which really slows down the dentist from
And-
what the hygienist can't do.
But because they and we can use something called public health. Or just dental hygienist, just public health and dental hygienist. They can do more than regular dental hygienists. They have to get training and stuff, and then they can do a lot more. Everything but scaling the assistants can do, correct?
Yeah.
So dental assistants can also do a lot more. And still, we're having trouble, so, in general.
Is there the dentist, they can offer the dentist payback of loans.
Yeah, they
Can they do that with the hygienist? And
I don't believe so.
Don't know about hygienists for them.
I don't think that's
I don't think that's a
something for
thing.
hygienists. I think it's only for
But that would be good.
dentists. But I think the competition here is that dental hygienists get more paid, almost close to like really higher pay in private
Yeah.
sectors. So the competition is just, you either have to increase their pay or they would
well,
just.
dental is always, you know, as a physician, I've looked at dentists, and I learned a few things that were very surprising recently. Is I didn't realize that their medical debt is about as high as a physician's, which completely surprised me, frankly. And their pay is more on the level, if they're employed, more on the level of primary care. So I can understand some difficulties in that. Now, if they own a practice, that's a different story.
And that's the, that's the issue.
Yeah, and there's not like real dental insurance, like,
Yeah.
and that was a split.
Yeah. Yeah.
And we have given in the last, I think 8 to 10 years, we've spent that $50,000 that we have taken into our budget for Promise Healthcare to do direct services to individuals in the county, and have specified, you know, we wanted these breakdown of these numbers to see how that is being best utilized in the county, so that we can then see how is that being, you know, utilized across hygienists, across supplies, and, you know, any other direct care service needs that they have. And so some of that breakdown that they provided before to us on page, I think it's 26 here, they've given us some detail in regards to that. In addition, they've also provided detail on the additional, for the last 3 years, we have given them the first year $27,000, the last 2 years $25,000 for recruitment to increase the number of providers, dentists in the area to meet the needs. And they've hired a few of those, and they've used those funds for travel expenses for those individuals to come in for interviews, for sign-on bonuses, for moving expenses out of that $25,000, and also for advertising, I believe.
And when I read that, I mean, I was just left with not a very good sense that I know where they're at right now.
They're making another request for another $25,000 for recruitment, and when we get to that, I can talk a little bit about where we're at on the fund balance too, because those funds, those last
they're
3
coming out of fund
items
balance.
have come directly out of the fund balance. So we've been drawing down the fund balance for assistance in this area for the last 3 years, and there's a request for this year. In addition, we've also supported the health education, the sexual health education that's going on in the community that we can speak to later on as well. And we've been funding that at $30,000, I believe, also for the last 3 years, correct? So we can talk about those two proposals that we have, and then what we have in the fund balance, and how this can best be utilized across programs, and what we're willing to commit. That $50,000 has just been a general item that we've kept for quite some time, because
Right.
we have seen the need for dental care services, particularly for children in the area. They're going unaddressed. And so in the budget for that we'll be reviewing in August, that $50,000 line item is still in there as a part of that budget. But we need to discuss also fund balance, and do we want to continue, you know, with that, you know, commitment that we have made on a continuous basis to promise for those particular services.
At this point, we don't know what the increase in revenue from property tax is going to be.
Travis did not give me that.
I didn't see that, no.
There's that, that's a concern. There's also, which Travis was going to talk about tonight,
Yeah.
is the fact that we still have the county, we still have the Carl and Provena, is it both that we still have to pay
Yes,
back?
that is not, that's not dispersed yet?
Not from the county, we're waiting on all the because we're, you know, we're waiting on the county, right, to do that, but we have for the district. It's gonna be a lot less than it was for CUPHD, because our tax rate is higher here. But for the county, I don't know what it is, I don't remember.
Well, let's see, I'm trying to think what that, it was about a 28% distribution dividend. So if you just say,
No, county, it has to do with the tax rate of the county,
Oh.
doesn't it? Because we're paying back taxes.
yes, you can
So
back. I thought
it's-
that was in escrow though.
We did have some money issues over it, but it's still money from Lumen. I mean, it's not.
It's gonna come out of this year's budget then or something. I see, I'm confused.
we-
I thought we'd escrowed that.
Well, so there's, again, there's the district and there's the county, and the county, I think we did, Mandy's not here, Travis isn't here, and those are the ones
Yeah,
who
right.
need to ask that, mostly Travis, but we knew at one point, we thought what we were going to have to pay back as the county
Yeah.
health department, and we did have that put back. but what is it, in the fund balance, is that where it's put back into, you know? So,
Yeah.
I
Is this
had
for
that in the
payback
budget.
from like that lawsuit against Carl?
The property.
I mean, at this point, why don't we talk to Carl and say like, look, I don't know how much you, I know. But in light of like, because the biggest concern I have is like, how much money do we need to set aside from like whatever is gonna come our way? And I don't know how much money we're talking about, but I'm like thinking about that, you know, like,
And
who
that's-
knows, right now we're talking about like dental health, and that's great, but we might be talking a lot more.
That's the purpose of the fund balance. So this group decided 3 years ago, we established a criteria to have a fund balance of 25 to 35% of our operating costs. Our operating costs currently are 2.2 million. And so 25 to 35% of that would be necessary for us to maintain our fund balance should there be any emergency and things that we need to cover, which we did initially when COVID occurred. We, tapped into that, but then we had grants that came across and we didn't need to go into large expenditures because those grants that came through from the federal government. I can tell you that our current projected fund balance sits at 23%. We were at one point at 38%. Again, we've been drawing down from it because we've been funding this additional, sexual health education and the expenses for recruitment for dentists in the area, funding those to Promise Healthcare. So that has been at 30,000 and 27,000 in the first year, so 57,000 in the first year, 30 and 25 in the second year, and 30 and 25 in the third year, so 55 and 55. So we've been drawing down on that. We're now at 23%, so we're now below our established and agreed upon fund balance criteria, which is why when we get to those items, we'll vote on this in the budget, but we need to have some discussion now about what we think we want to do in August when we vote on those items. To, very clearly, make decisions if, as what you're saying is we want to build that fund balance back up, then we may not be able to support some of these programs in the amounts that we did in the past. And
Well, we've
again, that
also
will
got
be
the
discussion of whole board.
education program in the schools too, which is
Yeah,
also coming out of
yep,
fund balance.
that's what she was talking about, the sex ed thing.
Yeah,
Yeah.
This is like Sophie's choice. like-
Now,
Yeah.
I'm no longer treasurer, so I kept on top of this better than, in the last maybe 2 years. 2.2 million seems like a very high budget. We did not have a budget like that. So is that coming from the federal stuff that came in? Is that an artificial number?
Well, no, because that money shouldn't be in there any longer. The COVID money and all that.
Yeah, how did we
that
get up to
should-
2.2 million?
Well, I'm trying to think, grants and contracts, so, you get, so still, the county gets, so when we get a grant, like local health protection grant, if it goes up, they're base awards, right? District gets one, county gets one, which is awesome. And then, on top of that, you get your population bump, so, for the population. So, we, in this county, we are actually getting 2 local protection grants, not that that would show up in there, but those did go up some. They've rolled a lot of stuff into the comprehensive grant now, so it's, that makes it a little more stable in a sense, even though there's a whole bunch of things in there that are little. And then it has to do with property taxes. So, I don't know, but Travis is the one that will.
Well, he's
has
on that side,
information.
but on our side, maybe what we could use when we meet in August is an analysis from our folks. A view over the last 10 years of what our total budget has been. And because 2.2 million has surprised me. It really did surprise me.
Do you want 10 years of revenue and expenditures?
Revenue, yeah, history of revenue and budget. And because what I'm suggesting is, and it would, without really knowing, what I'm suggesting without knowing is that 2.2 may be something that's happened from the outside, and do we need to be quite as concerned about the 25%? That's what I'm saying. The revenue that we're getting, some of, and how much of it is grant revenue
Yeah.
that is not gonna be affected by a tuberculosis outbreak or a bird flu.
Yeah,
And how reliable is it going to be is what will be coming in next year.
and I wish I knew. I mean, we all wish we knew. We're constantly like dancing around. Some things could go away in July, we know that.
Yeah.
And then-
That's another problem.
Yeah, and they could go away and we just don't know, and no one knows. So no matter how much we poke at people at the state, they just don't know, because it's the federal messing around. We know what the state budget looks like, but,
Well, the other thing I have to consider is some of those grants offset salaries that would then
Right.
come back to us. So, you know, the other downside of that is if a grant goes away, someone is still, you know, here on the job doing services despite that grant, because that's important for, you know, the needs of the people in the community. So we might see, you know, greater salary that's allayed to us because it's not offset by something that's in the grant.
Well, the professional enhancement grant, is that in danger of going away?
the SIPA grant, yes, we knew it was gonna go away though. It was gonna go away in,
End of '26.
okay, yeah. It was a time
End of
limited one,
26.
we knew
Another
that.
fiscal year.
Yeah, so that is still in there, that money's probably still in there, right? Or it's
I mean-
actually gone, I think we already spent that.
It's not gone yet. Not yet.
Is it earmarked?
We have it all like earmarked, I think,
Okay.
but I don't think it's gone. Because that's where the retention bonuses and stuff come from.
Yeah, and if you haven't earmarked any grant money, I would do that.
Yeah, do it so that it's.
Because anything that is not spoken for can be pulled back.
I mean, that's, I guess, like, next meeting we'll do our proposals, but, I mean, that's the thing is, like, are these organizations able to maximize external funding? You know, and, like, creating that buffer, creating that sort of contingency plans in case things change.
But, I mean, you know, you've heard me talk about like Public Health 3.0, and one of the things that we're trying to do here is move away from providing services because, well, it's expensive, but it's also unnecessary. It used to be, before ACA, it was necessary for some things, and God knows STDs were a problem because of a lot of things. And HIV back in the day, that was certainly a problem. But it shouldn't be now. We should be getting people into medical homes. But the one thing is dental. We absolutely, I could go on for a day. We cannot get rid of dental. Even though it is super expensive, we cannot, not that you guys need to worry about that, but in the district, we cannot get rid of it because there will be no place for these kids to go.
Well, we do have to worry about it because we're supporting a major dental program.
Yeah.
Yeah, it's important.
I mean, we've got to increase capacity in this community. I mean, if Promise Healthcare had enough dentists and staff and everything, we'd be like, bye dental, you guys can do that, you know, because they can bill differently than us, and dentists get advantages, so they have a lot of
They get 3
advantages
times as much
over
Medicare
us.
money.
But until, there is no way, I'm gonna think about cutting that until we know that there is a stable place that these kids could go to, because it's,
Just wanted to mention one thing parenthetically, which is that I've realized over the last several months is that I frankly have to say I'm very impressed with Promise as a developing organization.
oh, it is, and that's why I told them that
Yeah.
for years, we weren't really working with them very closely
Yeah.
because I didn't trust them because they weren't doing a good job. But what I want to see, and I think you guys know this, but they're moving into our east wing over there. And so the idea of that is to have clients from WIC and our other services to be able to go right over there. And,
One-stop shop.
yeah, pregnant moms right over there and start getting prenatal care and don't.
Not get lost in referral.
Don't get lost in referral. And this should be a big help. I mean, anyone can use it because it'll be an FQHC, but the idea of it is to really get these moms and babies in there. and anyone actually that's over here for whatever, so that's a good thing. But yes, they are different, but they are giving me hope. But still, they're having trouble getting staffed up and everything too. So we got to see that. And if it was buzzing along, we'd be like, here, use our dental clinic and hire our staff. You know, use our space, because we would be out of that, and then we would be doing what the other stuff that public health is really supposed to be doing. But we're not there yet. But maybe one day we will, and we are working with them with that in mind. That one day, maybe you guys will be stable enough to. I don't know, stable's not really a good word. You know what I'm saying, though. They'll be.
Yeah, it'll stay stable enough for
Yeah.
self-driving trucks.
Yep. Yeah, a little better than that, hopefully.
So we have a motion on the table for monthly reports February through April to approve those for Promise Healthcare. Is that helping? Any further conversation? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. We now have items 4, 5, and 6 under G for approval of invoices from the Child Dental Access Program. And those are items 8 through 12. So I would also entertain, we could look at all of those as one lumped together, or we could break them out apart if you would like to talk about them individually.
I would motion to do it on this.
Okay. Moved, do I have a second? Moved and seconded, any discussion? Pretty good. Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. We're now at H, CUPHD. We have approval of CUPHD invoices for January, February, March, and April of 2025 for services, items 13 through 16. Same as before, we could tackle those all together, or we could look at those individually.
Motion for an omnibus.
Thank you. Do I have a second?
Second.
Moved and seconded. Any discussion on any of those invoices? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. We now have an update on the Teen Pregnancy Prevention Program.
Hi. My only real update is that we've gotten a little bit further along with Thomasboro. We haven't been able to get back into Thomasboro for a few years. They had a student support staff person that was really kind of our champion in the schools, and that person left, and the teacher that we taught with also left. So we haven't been able to get back in there since then. But we just found an inroad with their superintendent, is actually the mother of one of our employees, which is great. They have a fairly conservative board, but we're hopeful that talking to the superintendent can maybe ease that proposal in that school district. We're really trying to get into Ludlow, Thomasboro, and Gifford, because those schools feed into the Rantoul High School along with J.W. Ader, where we're currently at doing this program. And so that would mean all of those junior high students from those schools feeding into the high school would have the same kind of baseline of teen pregnancy prevention curriculum.
Any questions for Whitney?
So we're not gonna talk about the budget issue on that until we get through that.
We'll let her give a proposal. She wants to talk about it.
I have a new proposal for that one.
There's a new proposal.
Yeah.
See?
More fun.
All right. Items 6 and 7 are CUPHD reportable diseases and performance management reports. We typically just make a motion to place these on file. These are included as a part of the website documentation and data that we also have the opportunity to review.
I will make the motion, then I wanna talk about it.
All right.
I'll second.
Okay.
Moved and seconded. Open for discussion.
Amy, can you pull up the reportable disease? Let's see if it's the same report that I looked at. It's the first one, yeah. All right, go down to gonorrhea and chlamydia. I was gonna see if that's the same one. Okay, So it's safe to go out there again, I guess, because there is no chlamydia or
So,
gonorrhea.
okay, that's a great point. At our last meeting, I actually,
I
so
brought
I know
that up.
somebody who works at McKinley, so I'm like, no way you're telling me that there's none of this, and like, they're like, oh yeah, no, there's tons of it, but what they do is they report to the state, and I'm wondering if it's a delay. So like McKinley would report or like give whatever data, they usually, cause I asked like, and she verified with like their lab director, like they would send it to the state, maybe that's why?
Why are they sending it to the state when I'm very clear?
That's a great
Well,
point.
If you,
That's a,
if
Hold
you
on a
click
minute.
on the
In
disease.
an information
Yeah.
age, it's just like
Correct.
CCUA,
Click on that.
why
If
are
you
we
click on
doing
chlamydia, it'll
this type of-
show
100%.
you, from January through June.
Where
So
is
you'll-
chlamydia?
it's
it's a lot of email I
Scroll
can show
down.
you.
I can't see that.
It's, I don't
Year
see
to
it
date
up
is
there.
0.
Keep going down.
Year to
It's-
date is
I
zero.
looked at
Okay,
all the
it's-
months.
There it is,
Oh, okay.
chlamydia, under class 2, reportable in 7 days.
Year to date is 0. Okay, interesting.
What
Wait,
the, okay,
how-
something's obviously.
Yeah, I think we
let me-
will look into this.
Let me just
Yeah,
text
'cause
Candy
McKinley
and
is
see
saying
what.
that
Well,
they
I think it's across the board, except there is a number for Hep C, which is believable.
Yeah.
Oh my
Yeah,
God,
I think-
yeah.
I
It
think-
looks like it stopped in July of 2024. Like January, February, March, April, May, June, July.
Oh,
Yeah, that's
July went to
probably,
0.
yeah.
July went to 0 and it's been 0 since then.
And I'm not being real critical about it. I know there's other things going on. This isn't the most
Well,
important
this seems
thing.
glitchy, like maybe something's not making it
Yeah,
over to the
feeding into the
website.
portal, because we have systems that feed into the portal here, but we'll look into this.
That's what I'm wondering, is
Yeah.
if they started putting it through the,
Atlas.
through the Atlas, so let me see.
so is it like, so when agencies will report to the state, I think probably, is it like the state then gives us those numbers or?
Mhm.
That's-
So
stop
each
reporting?
disease, they should be reporting to us. I don't know, maybe with STDs, because there are a lot of them, I mean, we get them.
Yeah.
McKinley knows how to treat them, but some places don't necessarily because they don't see them very often. McKinley does.
Yeah.
But we do get those numbers. They actually come back to us and we follow up a lot of times on them. So, I don't know. I'm checking with Candy. There's obviously there's an explanation there that I didn't realize was
I
on
started
there.
last week and I get a lot of facts from Carol physicians.
Yeah.
With sending facts about patients. with-
Yeah, oh yeah, there's
Yeah.
plenty
So I
of
think-
cases, so I know.
this- Yeah.
Wait, you're
No, I
giving
was
faxes?
I was
Like
not thinking that
telephone
we
faxes?
cleared that up. We-
No.
Actually, I bring it up, because I brought it up.
They are, no, they still are faxes, but they come in electronically through
Yeah.
they come into our emails, but they
Yeah, okay.
are still faxing them in some places.
Oh.
Good old.
Has aggregate data or individual patient data?
No, this is individual
Individual.
patient data.
So I think the
Is
main
what I'm
purpose
talking
is to
about.
do like the investigations and then just track,
Yeah.
patients' contact and then
Well,
reach out.
and the issue is, is it true for other diseases beyond the two that are obvious?
Well, I mean, it feels like a broken data connection.
Yeah,
So,
that's what I'm thinking, that it's just a connection fee.
Oh, wait, you said it
issue.
ended July 1st?
Well, in the graph, when I went to December 2024, and it
Yeah.
gives me all of 2024, it just goes to 0 in
Can
July.
you look on the health app?
So I
I'll
wonder
do it
if,
on here. Let me see.
some
Candy
certificate
has
maybe
got that in
expired
there.
that wasn't noticed, but now maybe
It's a Rob,
That makes
okay,
sense.
I'll check it, that's Rob.
Oh, so then the state would like update their system, which would then, we would get that feed from that? Is that how?
I'm putting
Is-
my IT hat on, I guess, and
Same.
that, the fact that it just goes from nothing, like, straight down,
Yeah,
that sounds
yeah.
like something shut off, and
This
usually
happens
it's
to me, like I have a Microsoft form that my providers fill out to tell
Yeah.
me how many kids they saw each day, just to, because I don't believe the numbers that get automatically generated from our electronic medical record. And it tells me when the connection's broken, so they fill out the form and it feeds automatically
Yeah.
in the background into a Excel spreadsheet. And, my data goes to 0 if the connection's broken, I just have to go in and fix it. But that's what that looks like.
Yeah.
Yeah, yeah,
Or
yeah.
maybe it's migrated over to the Atlas and we didn't change it on our sheet, so I'm
That-
checking with Rob. and
Is that
see-
new system that
Mhm.
they demoed for us last time?
Yeah, but trust me, we're still getting STDs.
Yeah, I just,
Yes, there are people getting STDs, sometimes multiple.
Always a ray of sunshine.
Yes, yes.
Is there a way, I mean, without inundating organizations to report, but like, why not, if they're faxing it, that's like so arcane, like, in this day and age. Cause like, why not just send it to us as well, like, then we don't have to worry about all this gaps. But
Wait, why doesn't who?
like, any, like, we can't
Whoever's
like,
faxing.
cause they're sending it to the state and like,
They're sending it to the state, but I'm pretty sure we're still getting those. We always did. I mean, I don't know.
You got copied on it? How does
Well, I
that,
don't get those anymore. So, okay, he said it is on the, so communicable disease is now on, that's the issue. It's on communicable disease reporting. So we have to switch that over to, let me check and see if it's on here.
Yeah, can you pull
No,
up
he
that
said
list
it's
on
on-
here? We can take a look at it.
Well, no, this is the same thing. This is what I think this is what he's still showing me. He said it gets put on there online. This is June, let me go back. Let me go to March. Nothing to do in winter, so we should have some decent numbers for then.
I track.
No, there's nothing in there. Yeah, he's gonna have to check and see what's happening.
But yeah, thanks for bringing that up, because it reminded me, because after the last meeting, I asked my friend who works there. And I'm like,
well, you know, I hadn't really, I mean, I think a lot of, if you realistically on the board, that wasn't one that you opened up every month.
No.
And I started doing it last fall, just to see. And, yeah, January, yes, where I started seeing that there was no gonorrhea or chlamydia when we had like
No.
87 cases a month. I mean, you know.
We're still having them.
Yeah,
Yeah.
it's a lot, and wow.
yeah, I feel like this is a connection issue, just
Yeah,
the way it
it's
has been
something,
said.
he's Rob responded and he's looking, so,
Yeah, it's something.
but I'm looking on
Or
this and I don't
the-
see anything.
August meeting, could we perhaps for the packets then have those communicable diseases, the up-to-date information for the 2025 year? Do you want any more than that?
Yeah,
Whenever it's done.
Well, if
it
he-
looks like 2024 was good. So
Yeah,
if you
I was
maybe
gonna say,
take a
if
look
he
at
fixes it, it'll fix the whole thing.
It'll fix the whole thing,
So
okay.
it'll, whatever the glitch is, as soon as he does it, it'll fix the whole year, so. Yeah, there's something in there, it's really weird.
Any other discussion? All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. That takes us to old business. The item on old business is an update on the long-term care beds in Champaign County. So I did have an opportunity to speak to Kathy Emanuel and her team that's been working on this last week. And what they're looking at now is a model called greenhouses, but not greenhouses that we might traditionally think of in terms of plants, but it is a model that comes out of Arkansas. They've looked at a lot of different companies. They've talked to places that have been involved in the sale of coral arbors and other places around to see if they would be interested in having a skilled long-term care facility. And unfortunately, after a lot of pursuit and information, they just didn't find anyone that was interested in opening up a skilled bed facility in the area. So they're now looking at these alternative models, and this greenhouse model has a model where there are 8 individuals each has their own room, and there is a shared kitchen and a shared living space, and there is one CNA or LPN that is assigned to this group of 8, and they help with activities of daily living, laundry services, cooking for them, baths, supportive things, and then they work with other home care and other agencies to provide additional services, and then should they become at a point where they would need hospital care, then they work with resources and hospitals in this area. And so she's been talking with a gentleman, and she and another individual actually did a trip, kind of a reconnaissance, to one of these places, and said that they were fabulous and she really liked the setup And so they're hoping that they can entice this individual to perhaps be interested in our area, to open up a model of these particular types of greenhouse environments here in our area. So that's kind of where they're at right now. We were on the phone a lot longer than that, but they had tried lots of things. So it sounds like they have been working with a multitude of individuals to try and bring something to the area, and unfortunately just hit a wall with a lot of different corporations. And then we talked about funding mechanisms, and so they're hoping to have another meeting of a group. College of Medicine is interested, from the College of Nursing. We're also interested in how we can support these services. They have talked to some other individuals across the University of Illinois campus as to how perhaps if they go with this type of model, would there be opportunities for student engagement in these areas? Social work students, engineering students, if they needed, ramps or, construction or, things are done, or, we were kind of just talking, a lot of ideas were flowing when we were on the phone together, of how we could get involved in some of these things. And then corporate sponsorship, because originally the thought was to look at, federal, state funding. We just all had that really long conversation about what's happening now with NIH and HRSA and other types of grants, and so there may not be mechanisms for this type of support services. However, there are corporations who are investing in these types of things, and we talk big scale. You can go down from Gates Foundation to Bezos to Warren Buffett, to going down to small, looking like East Central Illinois Foundation grants, United Way, other groups. Whom could we work with in the area? And then we started talking about people in the community who have businesses, founders of many corporations that came from the University of Illinois or came from our area that might be interested in perhaps putting enough funds behind one of these. I'll sponsor one house or I'll sponsor another house and the construction of that, and could they then come with, so now the goal is to try and get that together and come with a proposal to this individual that has this model and say, if we could come up with half, or maybe 5 of these or 4 of these, would you put in the other half if we could get some sponsorships to cover some of that? So that's kind of where they're at now.
Is this idea at all connected to Clark Lindsay's greenhouses? Is that the model they use?
Those are used, it's my understanding, those are for dementia.
Not anymore.
Oh, not anymore?
I
Okay, then
believe
it
that
is the
because
same
they now
concept,
open
because
up.
I actually met
It's
with
from my
Kathy
mom.
last Friday and we talked about all this stuff too.
Oh,
But
okay.
is what Clark Lindsay is doing now this model, so that we actually have one in the community now?
Oh, she didn't mention that, so my apology about Clark Lindsay
I've visited
specifically,
clients
but,
there,
yeah.
and it seems to be like that.
Yeah, that's what the greenhouses are. It's like and they have them a lot. They've really started a lot in the U.S. for dementia, but there's no reason. It really, back in the day when I was a kid, that's what nursing homes were. They were in a house and they had everybody had their own room, but they had a kitchen and joint kitchen, and the greenhouses are nice. They have a lot of them. They don't all call them that, but in Peoria I know there are some that I've been in. And
So the studies about long-term care beds in the community, and that means to me 24/7 nursing care available.
Yeah, that's what it
true
is.
here?
She's talking about them being skilled care greenhouses.
Yeah, because it's not like an kitchen act, like where it's like people on vents. It's sort of like an assisted living. With
No, it's still a skilled nursing, only it's not that. But it's where you would go if you were on a vent or you were on something, but they would be, I don't know about a vent, maybe that's a little
That
much.
would be more.
That's probably a little much.
Because
But
their
like
models
with
is like
skilled
one
nursing,
nurse for
so-
30 plus patients.
So
It's
they
awful.
could be like in what you would think of people being in a nursing home,
Yeah.
but they would still be able to, the person would, the people there have 4 people under them. So they're watching 4 people all the time. They're cooking for and feeding those 4 people. It's all, they're doing everything in there, but it's not like a big kitchen and all the food's shipped over or something. They're actually in there cooking for and taking care of those 4 people all the time.
That's like fascinating. I mean, I think I love that idea.
Yeah, it's a great idea. It's I don't know.
Well,
Let's
the
see.
We're
very
using
big
economies.
problem with Illinois is its very low Medicaid reimbursement rate. So
Yeah,
why
I mean,
a lot
that's
of
like the
people
whole
aren't
thing.
interested. Corporations are not
Of course
interested
not,
in
yeah.
doing it.
I mean, that's like, yeah, and then you go look at some of these like LTAC facilities, it's just like, it's awful, because like, and I get it, they're also underfunded, but like.
Well, my recollection of what Kathy said was that in Illinois, because of the Medicaid reimbursement rates, the only model that really worked was the continuum of care model, where, like Clark Lindsay, where you're in an independent apartment and then you move to an assisted living and then you move to dementia care and then you move to nursing home. So that the people who are in the first level are helping to fund.
Subsidized really.
Yeah, and that's the only thing.
But that's not Medicaid.
No, that's what, well, that's
Yeah,
why
it's
they're.
private pay.
Well, but that model that I just described was the only one that got close to cash flowing.
Yeah.
If you just ask somebody to open up a standalone, extended care, a nursing home, you can't do it in Illinois because our Medicaid reimbursement rates are so low. That's what Kathy said.
Yeah, no, I agree.
So I don't know where this fits into that.
It's an interesting model. I mean, one thing I was just thinking about the food, because like the economy is scale. If like people are cooking, I work in kitchen, so that's where something. If you have multiple different houses, you could have a central.
You could have a central kitchen.
Yeah, central kitchen.
Yeah.
So
Yeah, they don't though, typically, in the ones that I've seen, they actually, well, that's not true. I think they do bring some of the food over there, but they always have
yeah.
things that they can cook for people 24 hours a day if they wanted to eat something. That's definitely how it was in Peoria. They did have the central kitchen for like, probably like Clark Lindsay does, bring the food over, but then they can still cook or have snacks there or whatever for them, cook for them if they want something at any time of the day. Okay, so it seems like the STD thing has been solved. The STDs are done separately than all the other communicable diseases, and that they are only being pushed out, reported out by the month, but at the end of the year. So I can,
Say that again?
they're only being reported on this sheet. So I told Rob to check into that and tell her maybe we need to do that more frequently.
Is the end of the year July?
So, I'm sorry?
Is the end of the year July? Because you said it dropped off after July.
I think the thing is, I think it's calendar year though on the reports,
What
I
happened in
believe so.
July through December of 2024? You said it dropped off. So that was
That would mean the
I
reporting
think
is
we
done
can,
in June then.
I think we can, for the meeting in August, we can just work on that and have a 10-year, right? What was your?
No, that was,
Yeah.
they wanted 10 years on the budget.
Oh,
Yeah,
okay.
the budget, so I think the past year.
Okay, past year,
Yeah,
okay.
the past year.
Yeah,
for
I think
the-
we can,
Yeah.
if it's by month or, bi-weekly or weekly, we can get that.
That would be terrific,
Figure it out.
thank you. And then Kathy will hopefully be at the August meeting, so I'm sure there'll be lots more that happens between now and then, and she'll have much more to share on the work of that group. But it sounds like that group has expanded quite a bit.
Mhm.
I mean, she made it sound like there was like 30 or 40 people involved now that are working on this, business owners, community agencies, universities, so hopefully we can.
Just in time for
I
no
love
Medicaid.
leveraging also the students, like, I see it as like for pre-med, pre-nursing, also for the, like, med students, because now it's like the boards are pass fail, so how do you differentiate yourself?
Yeah.
You go into all these conferences, like, why don't you help out your community, you know? I think that could be something.
Our next agenda item is other business, and our first is we have an update on discussion from our last meeting. So if you would like to talk a little bit more about what we discussed previously, Bethany, really appreciate it.
For these like officers or for the?
For the article.
The article.
Yes, thank you.
So we brought the health ordinance up for discussion at the last committee of the whole. And it was, usual suspects all about it. Two people had questions.
Okay.
They requested, I don't know if it was the health inspector or somebody who's in that line to come in and kind of like, justify passing, the ordinance as a whole. The rural reps didn't like that it was just a carbon copy of the city They're like, we don't need that big city stuff out here, type of thing, like.
Because they have different germs
Yeah,
out there
right,
in the food.
it's all that clean living.
You're talking about the placard.
Yeah.
Among other things, it was like, we lifted the whole, kind of chunk of the ordinances and everything, but, yeah, they were complaining about the placard, and, I think they just need kind of a,
So you didn't pass it, in other words?
they tabled it, they didn't vote it down. They tabled it until you could come in and basically do the same song and dance you did the last time, except what I would like you to do is focus on the cost savings of keeping people from being ill through this program, because everything is blowing down the mouth right now. And if you want to convince them, you have to give them, if you don't do this, this is what you're looking at,
Well,
You
realistically, in
have-
terms of a business owner in a restaurant,
Yeah.
if you develop an outbreak in your business,
Yeah.
you're probably gonna lose it.
Yeah, but there was some complaints about overreach. We have a board member who's actually in food service, and was complaining about one time, one of the inspectors came in and dinged them for having like a spray bottle too close to the hand washing sink or something. It was some people were saying for that. I don't know how true that is, if you could dig out that,
There's always,
I know.
there's
There's
always
always
complaints about things like that. Those things are there for a reason.
Right.
What was in the squirt bottle was poison.
Right.
I don't even have to know the situation, because the situation happens all the time.
I would-
Or unmarked things.
I
They'll go-
would bring
I
that
agree.
kind of thing
Yeah.
to because, you hear the things third hand and they sound horrible, and then
Yeah.
you hear like, no, this is actually what's going on,
Yeah.
And,
Do you want, Sarah at that meeting, did she already get asked to go there from EH director? I think so.
and you know who's been asked to do it.
Oh, okay, all right,
One
so.
thing I did have, a bit inspired by the crumble cookie, which was like a nonsense email, but like, about this, our policies for food inspection, they're pretty standard, no? Or do we do something more? Because I was hearing some grumblings from like restaurant
There's,
people that like.
there's always grumblings, I can
Yeah.
tell you that, I've been
Yeah.
here 30 years, there's always grumblings. Because it's something that's regulatory, just like the fire marshal and the plumbing inspectors and how, they all get it. But the best thing to do, we did put together some new flyers, so if you go on the environmental health website, I think one of the best ones shows you how the FDA food code, the state of Illinois food code, and our local ordinances work together.
Oh,
I think that's the most useful one, so that one's on there. Then there's another one, one of the complaints that we get all the time, especially from the cities, is that our plan review process is too slow, and why can't these bigger places pay an expedited fee and get to the top? That happens in places. It's not gonna happen here, because it totally disadvantages all the small businesses.
Yeah.
Totally disadvantages them. And I don't know why I have to say that year after year after year, but I do. Because if we did that, we would literally be just constantly
Change.
jumping up, doing things for Walmart and Costco and the big chain restaurants and things like that. And the little places would never get it. So it's based on how you get your stuff done and getting it in. Most of these things, and I have to, troubleshoot a lot of these situations all the time. It's, and again, when the person said that they were dinged for that, that means that it was marked on their sheet. It doesn't mean that they were shut down or anything
Right.
like
Yeah.
that. But it's
So
legitimately a thing.
that was a thing that I don't know.
but that's the thing in a restaurant, you have to, like, you can't,
Absolutely.
you
Right,
can't
they're
be
not
going
disorganized,
all
like,
year,
yeah.
But they were like, oh, and it takes them so long to get out there, and like, everything I've heard is like, they've been out right through the next day, like.
Yeah, I mean.
In which case, it's like, well, you didn't give us enough time to fix it. So,
Yeah,
which
it's-
is, if I was taking too long.
I mean, there are,
But I would like to see some statistics about, okay, so, how many people actually get shut down? How many
Yeah.
people actually,
Very few.
You've got a very public case going on right now.
Yeah,
Yeah, we do, but again, that situation could have been resolved the next day.
Yeah.
We can't do things for the places, right? We can't fix it for them, we can't do those things. They have to do that, and the same thing with, they have to have a certified food manager and somebody who is paying attention to these things. We get it out in a million different ways, and if you've looked at our website, the environmental health website has everything out there. We've done open office hours so that small businesses and, well, anybody can come in. Even if you're like, today, you're like, oh, I want to start selling coffee and cookies from a stand at somewhere. You can come in and talk about that ahead of time to get, to know the things that you need to do. It's not a mystery, it's all, it's all there.
Yeah.
But people
Make up
either,
short, yeah.
they don't ask a question, or, something happens. And sometimes when places are failing, they like to, put it on us, like we've caused their business to fail.
Yeah.
So it's a lot of things.
So it's not like inhibiting businesses?
No,
or
of
there's-
course not. We have 1,300 active licenses right now, and 80 in the plan review queue. I mean, businesses are opening here all the time. We only have so many staff, and we only have so many staff. We haven't raised the permit fees in a long time. That probably also needs to happen. You can only do what you can do. And when we have to spend inordinate amounts of time, like 4 or 5 of us sitting in court, or 4 or 5 of us, working with the attorneys or doing all this stuff, that's just time. You can't get that back, and we can't tell them, oh, you weren't in restaurants this week, so now you have to go and, you have to work an extra, 8 hours because you can't do that.
Yeah. Yeah.
So, anyway, so we, Sarah's been doing this job in one form or another for 34 years.
Yeah.
And she knows all the stories.
Yep.
I'm sure.
But
Bring them.
Yeah.
It seemed
so-
like it was just
and
Bring them and
rumbling
tell them,
for
look,
no
if we didn't do
reason.
this is what happens.
Yeah.
How many people die of food poisoning every year? Babies, pregnant women.
Right, I mean,
Hysteria,
it's-
you know.
And the thing is, the good thing is that the way the food programs and all that stuff has what we have. So what it does is the plan review, that's another good one to look at. There's like 4 or 5 new things on there we just put up. But look at how the plan review, that's the most important thing, because that is when the restaurant or whatever food service is first started. And then that's where your menu, everybody's like, oh, we just get a building, we open a restaurant. No, your menu, your equipment, and it has to be certain equipment, your menu, your equipment, and your processes all have to be put together in a way that's going to ensure safe food from, into the person's body. You have to have that all laid out, and then the inspectors go back in. And if you're going to change any one of those processes, you need to contact the inspectors before you do it, because that's what all the inspections are based on. So if you look at those flyers, I think they're helpful.
Okay.
But
Yeah,
we just did those because of all the, got sick of answering a lot of these questions, and I couldn't explain it well because I've never really done those jobs. So we put these together, and I might add, we used some AI for it, and then we used our designer in there, and EH vetted everything, so I think it's a good way to get some of this information out there.
So, when you say you have like flyers for how to set all this stuff up, is it possible, because I'm pretty sure, like, you've probably got a standardized, there's gotta be some kind of convergence of standardized processes for, like, a chicken restaurant versus sit-down restaurant versus taco truck, whatever,
Exactly.
right?
It
So-
all has to do with those 3 things.
Mhm.
What you're selling, because let's just use an example that a certain place just used on us. They said that they have a restaurant in another county and a restaurant here, and they don't have to have a piece of equipment that we're making them have here. Well, the reason why is because in this restaurant, they're doing big pieces of meat and ribs and things like that have to be,
It takes more cooling to
it
cool
takes,
them down. 'Cause
and you
they're
have to
big.
cool
Yeah.
them, right, and you have to cool them faster, you have to get it in there, and then you have to store it at that temperature, because if you don't, when you come back out, then the heating process is turning into a bacterial,
Yeah.
basically an incubator for all that bacteria. The other place, what they're doing is they're taking like chicken wings and french fries and things out of a freezer and dropping it in the hot grease and serving it immediately.
Yeah.
There's no
Nothing
storage
sitting
of
around.
it,
Oh.
right. So these are the things that all matter.
Yeah.
And it's all done at the beginning, and all the stuff is there. I mean, and if there are questions, then they need to ask those questions as they go. But what happens a lot of times, places will get impatient and just start.
Yeah.
And
And then they get dinged, and then they get mad.
Right.
Yeah.
And is there a way for like, let's just say before committing capital, like if they can get like a lot of their ducks in a row, then to consult with and to be like, does this sound like a reasonable plan before we start, or what
That's
else would
part
we
of the
need?
process, isn't it?
Yeah, that's part of the that's a plan review. Like one of the restaurants that's moving right now, staff went out there ahead of time to kind of talk through it before they ever
Started
got
doing
their
stuff.
plan review even going.
Yeah.
To say, you know, this is what
Now-
they're thinking, because before you build things, it's easier to,
Yeah.
to change it on
Correct,
a little
yeah.
piece of paper than it is.
Exactly, so.
So my question is like, so, who does their planning? Do they come to you, you do the planning and then they implement it, or do they get some
No.
third party guy to look over it? and tell them how to
They're
do it?
doing, usually places have, you know, they have to have an architect or somebody there because they have to have, because we're just one piece of this.
Right, right.
We get blamed for all of it, but really it's like the plumbing inspector, you know, the fire marshal, all of that has to be done,
Yeah.
just like with any kind of building. So we're just one piece of it. And one of the things that we had suggested to the city is that if they really want these things to go faster, feel free to hire somebody who makes sure that when they turn in their plan review, that they turn in all their paperwork, that it's done, and it's done right, and they've done everything, so that we don't have to send it back and then start over and send it back.
So I'm wondering, instead of having somebody do it, is it possible to automate the process where you have, like, I know we have interactive, you know, Excel spreadsheets where you can fill it out, and there's certain drop downs, and you do this and that, and it has, you have things, you can
We're
pick
whereas-
this, and it's at this level, you can't pick this because that doesn't meet the requirements, it has to be one of these options.
That's exactly what we're in the process of doing.
Awesome.
It's online plan review, it's an online application.
Yeah.
So that, yes, it won't even be submitted until it's all done.
Yeah, and it's all right. Like
Yes.
you can't have.
Sarah told me that, and my head about popped off. I
Yes.
didn't even know there was such a thing like that, but she said, nope, they're in the process of getting that going. It's part of our digital health department that we use, so
That's
yeah,
awesome.
it is.
Because I think that will help a lot on both sides.
Yes, it will. I mean, but it should, at least, you know, we're not gonna come out there every time somebody says something, we don't like go publicly and say, okay, actually, this is the real story. We just keep plugging away, and they hopefully will,
You gotta work on your PR, you gotta be out there.
Yeah.
And just spread the response and like,
Well,
no, actually,
But it's
you're
true.
going to, you know, kill
Right.
30 people if you left that thing where.
well, we can't do that.
Before starting a restaurant, there's so much thought and consideration that should be going into it that any
Yeah.
professional would do it. I mean,
There
I don't
there
think
is,
people
but-
realize how badly it can go if it goes bad.
correct.
Because just the volume, like,
Sirloin Stockade is like a perfect example, and the other, you know, because they had a foodborne outbreak and that place closed, and no amount of anything would get people back into there.
right.
But
Which I
we're-
think is the most thing they're worried about with the placard thing, but it's like,
But
but then
that
at the
isn't
same
it.
time, they're both, their arguments were both that, oh, if we, you know, have this placard, you're saying we're dirty, and also our local, you know, population doesn't care about those and won't look at them anyway. It's like, which is it?
No.
Come on, that's
Yeah.
that's not an excuse. Like,
Yeah.
I feel like channeling Gordon Ramsay
Yeah.
into
Yeah.
just being like, this is unacceptable.
Yeah.
It's
Yeah, and
unacceptable.
it's really,
Your
and it's
standards.
not,
And it gets on the news anyway.
the
but
vast-
Every Saturday it's on the website all over the place.
right, and you know where that comes from, we don't give them that.
No, yeah, and then, I don't think they know that either, but.
No, they
there-
think
there
that
are
we do
some-
that, we don't do that.
There are some,
It's FOIA-able.
yeah,
And
and like,
we
it's
put it on
an
the
easy,
website
it's
to
a low
spare
hanging
ourselves.
fruit.
And I agree, that information, there should be for the public to digest if they choose to write about it.
Right.
You know, but like, yeah.
But, you know, I'm not gonna go check WCIA's website before I go to, you know,
No.
Bubba's Ribbon Tips or whatever. out in the
Exactly.
middle of nowhere.
Exactly.
Because I stopped by to get gas and I'm hungry
And
I mean,
people
it's
do.
like, go to New York, go to any place, they
They have 'em.
gladly,
Yeah.
I mean, it's like, you want that because that tells,
Tells you
okay,
at a
my
glance
food
that,
is
okay,
safe.
I'm not gonna die if I eat here, yeah.
Yeah,
Right.
and the amount of people that have had red placards is
Very low.
very tiny, and,
Yeah.
and they're gonna be closed anyway, but
Yeah.
what'll happen is, what happens now outside of Champaign-Urbana, if a place is closed, then they're gonna have something on there that they're having plumbing problems, or they're on vacation, you know. And that's, people, when they find that out, they get irritated too, but it's not, and even like the yellow placards, it's not, people aren't gonna be like,
Oh my God, I'm never going there again, yeah.
right. It just.
My
it
friends and I
just-
used to be like, if this Chinese restaurant doesn't have bad, you know, it doesn't have at least one bad health review, it's not really gonna be good.
Yeah.
And it's
And if you go in there and it's dirty, that's one thing, but what
Yeah.
we're interested in is not, it doesn't look like crap. We're interested in, are
Are the procedures being followed? Is
right,
there
are they washing hands, or do they have hot water, do they have,
Right.
all these things. So that's the stuff that we're looking at, and we're only in there at the most 2 times a year,
Yeah.
which I think people also don't understand now. When we get a complaint,
Mhm.
then we have to go out there,
No,
which we
it's,
do get complaints.
I
And
think they only notice the ones where you're going back 2 and 3 and 4 times because they haven't fixed it yet. And they're like, oh, they're harassing us. No, you're
no,
fixing it.
you have to fix it, and we
Yeah.
have to keep going back, and that, again, a lot of places will charge out the rear for having to go back multiple times,
Mhm.
because again, it's taking staff time.
Yeah.
We have not restructured all of our fees.
Yeah.
Let's
But, you
do
know,
that.
as we lose money from other things,
Yeah.
and that has to
You're gonna
support
have-
other things, we may have to.
Yeah.
I think so. I mean,
I
like.
mean, and it's
I
also a
don't-
nice, deterrent to them having.
It's just standard practice wherever you go, at least in this country. This is like your normal,
Yeah.
say things. And so like saying like, oh, I don't wanna put up something that lets people know that I'm not following protocol. Like, I get it, like when the health inspector, I remember when I worked in a restaurant, yeah, you had to like move this. It might be something so minor.
Yeah.
Okay, that's
But you
easily
see-
addressed.
Yeah, and that's called corrected on site, and it's
Yeah.
right there on the thing, so most things can be corrected on site, like the bottle, the poison, right there by the food, like we've seen all kinds of things, not me, but EH and health inspectors, and there's certain things that just happen all the time, and if the food service manager isn't they're telling you and reminding you to do this, which they should be, to not do that, then when we're in there and we see it, that's right on there, so.
That's 100%.
they'll be
Your
reminded of that.
manager should tell, if like, we're doing pizza place, so, worked all the way from line. And so like, yeah, that's the whole point, right? If you are getting yelled at, then you need to, as a company,
Yeah.
take that same.
A few of us around the table aren't saying very much because we feel like we've had this conversation.
Yeah, you have.
And-
For years.
And there's an aspect to this that's cultural and
Yes,
political, and
100%.
Yeah.
it doesn't make sense, but it's what's out there.
Yeah,
So,
That you can't just wave it off and be like, oh.
They should
they're
just
all
go to
gonna
eat
be like
street
that.
food
You
in
gotta-
India, then they can
you gotta-
feel how we feel about
So
this.
Julie, are you okay with following up with Sarah? To
well,
get
yeah,
those
I'll wait
statistics
until I
and
get
the
a
information?
message,
Okay.
that you want something, and then we'll get it to her. You can email it right to Sarah too, like if you have a meeting that you want her or somebody to be out there.
Yeah, we can get it on the agenda.
I just want to mention that in Utah, there is 13 local health department, and with inflation and all that, they adjusted their fees
Yeah.
for inspections. And usually, if they go back twice, you have to pay extra fee for staff. I think that's just
It's reasonable.
reasonable. But
Maybe not for the mandatory inspections, but if you have to, and it can't be corrected that easily, and you have to pay, then that's also, that's money not like we're being evil.
Mhm.
It's actually gonna go to helping our balances so that we can fund
More
things.
inspections.
Right.
They're not gonna wanna hear that, but.
that would,
Because-
that would be.
Because you may recall that when I went to the county board, I don't know how many years ago, when we were raising the sewer fees, and I said, I don't think you're understanding. What you're doing is you're using taxpayer money from the people in the county to pay for you're
Private.
subsidizing people's private sewers.
Yeah.
I said, that would be like the highway department putting in a private driveway for somebody, and their response was, well, we do that.
What?
And I was like, what? I was like,
So that's like the part
I
that need to be
know.
like
I was
addressed,
like-
that is the waste.
yeah, I was like, I'm
in
sorry, what?
government. It's
I mean, so I just was like, oh, well,
Unless they meant, oh, when we tear up the road in front of their house, we replace that part between the sidewalk.
that
and the
wasn't what it
street or
sounded
something.
like, but I was just like, so. So I was like, okay, well,
That was-
because they couldn't understand why, what I was saying was a problem.
Yeah.
I said, because you're taking money from
How long
everybody.
ago was this?
It's whenever we raise the septic
Inspection.
inspection fees.
Yeah.
So it's been a
Which
while
wasn't a
ago.
really big raise anyway, was
It wasn't, it wasn't, but it was like,
But I think that that's something that, I don't know how to, I think that's really reasonable and we should adjust and now it's good to get all this context, cause I was hearing rumblies here or there, and I didn't buy it because I'm like, I'm sure that we're not doing anything so different from every other health department in this country.
Well, and I explained to the mayors too, what this was, why it did seem like for a while that we were doing, because the FDA food code things were coming down the line, we knew about it. We implemented them slowly over years to give people the chance to adjust and know what they were, and we talk about them, and, you know, so technically, we were doing things before it was actually required, because, you know, it took a long time for the other counties to get on board. Now, if the other counties aren't doing them, it's just because they're not doing their jobs like they're supposed to be doing it. But I doubt that it's the same.
They're all this stuff, I mean, it's just like,
It is scary.
have pride in what you do.
Right,
and know
but
your
like when Jimmy
standards.
John's had that sprout outbreak, that didn't
Oh,
really
yeah.
hurt them because it was made clear that this was an ingredient that was brought in.
Right.
They couldn't do anything about it, and so.
It wasn't anything they did, it was just.
Right, it was nothing to do with that, and I was pleasantly surprised when I went through there to get a veggie sandwich, and they told me they didn't have cucumbers, and I was like, well, good for you.
Yeah.
Because those had been
Because they
recalled.
were, yeah.
But was I thinking of that? Had they been on there, I would have been like. I probably would have.
It wouldn't be good to get you sick.
I was hospitalized here with foodborne illness, but I got it from Chicago. That did not stop the ER doctors from laughing themselves sick over that. I was like, I was laying there thinking I was gonna die, and they're like, this is sort of funny. All right.
All right, thank you so much, and.
So I will send you an email, it'll probably be the next cow to give you time to gather up stuff.
All right.
Oh, maybe this one.
Thank you very much.
I think we have enough.
Our next item is slate of officers and elections. So annually, we elect, we have a chair and a vice chair and a secretary treasurer / position. Interested in currently those that have been serving in that position, myself and Kathy Emmanuel. Dr. Peterson served in the position, David.
Yeah, I'm no longer treasurer. David is vice chair.
Vice Chair, Kathy's the treasurer.
Yeah. Kathy is.
Thank you for getting those applications in finished, appreciate that. I'm also on the policy personnel appointment side.
Thank you.
Thank you for those if you had done
I will
I'll
entertain-
move that we keep our current officers who are doing just a bang-up job.
Is there a second?
Second.
Any discussion? Is everyone willing to serve? David, yes. Kathy's not here, we'll
My
listen.
workload is not that huge here.
If all three of you
David, I
were,
could sit
You gotta
somewhere.
miss a meeting once.
if all three of you were missing, we'd still appoint you.
That's why you show up to meetings, you don't get appointed.
That's right.
Hearing no further discussion, all those in favor?
Aye.
Anyone opposed? Abstentions? Thank you very much. That takes us now to discussion of the upcoming budget. As I stated before, the first item there is fund balance and the budget. So Travis Woodcock with Champaign County, working with Steve Summers in the County Executive Office, has let us know that our current fund balance projection for FY25 is at 23.
Amy, can you put that up, that letter
Oh.
from them?
That would be nice.
Oh, yes, thank you.
Do you have it?
It's currently at 23.07% of the unexpected fund balance to expenditure ratio. And that's based on a $2.2 million in expenditures. And we had set a goal 3 years ago of that balance being, 25 to 35%. So he's just letting us know where we currently stand on those projections, and that we're currently below that. And as we talked about before, lots of reasons to be concerned about that, because we cannot, as we have in years past, most importantly rely on, should there be an outbreak or something that we need to address, that there will be federal funds available to support and assist as we had with COVID or, with various other types of issues in the past.
Probably more important now.
Yeah.
right? So just those things that we need to, as we were looking at the proposals before us, just want to make sure that everybody was aware of this. So I had asked to get this information, and then for the proposals, as I stated before, you have those in items 18 to 24 and 25 to 32. And you also have, I asked Promise Healthcare to provide additional supportive data as to how those expenditures or how they have spent the funds that have been awarded to them over the last 3 years. So you have that before you as well. And then Whitney is here to provide her proposal for the services for adolescents in Champaign County schools.
You know, one thing is like, to your point about the elasticity of a budget, because like a percentage is like, if your overall budget is increasing, let's just say, right? Then, you know, is it better to think about it as a percentage or as a total amount of money?
Well, we do it as a percentage of, like the budget, because I don't know how that was originally thought of, but it gives you X amount of months kind of thing. I can't remember exactly what it was, but when we first did this, we investigated a lot of health departments all around, and they're all over the place in how they do it. I mean, they are all over the place. Most of them do a percentage, but you know, what was happening with the County Board of Health that was a problem was that every time they were like spending all the money down to nothing. And that's scary. Yeah, that's scary. So, and
I will
then
also
this
note
group
that,
has pretty much not done that.
keeping that balance and keeping a steady balance there also helps our credit rating, and which helps us get lower interest rates, borrowing ability, and so it all.
I didn't even think about that. Do
Oh,
we
yeah.
issue out munis?
Huh?
Do we actually issue out municipal bonds in this?
We
county.
take them and we don't issue them.
Yeah.
We'll
But
take them out.
We had bonds when we financed the building originally, but it's paid off.
Yeah. So, I mean, we are still paying off like the nursing home. We got the Carlton. We've got, we're paying down, our health insurance for our employees went up like ridiculous amounts, like 13% 1 year, and I think it's going up again, probably that this year. So it's,
CEOs need those $1 million.
it adds up. So,
And we can be told by county board when they look at the big picture what's wrong with our request, but I think we still have an obligation. And having lived, I've been on long enough now, and I've been impressed, Julie, with your leadership, and you've taught me that of all the activities in the county, ours is one where the need might happen overnight.
right.
And we're now living, it's not like COVID, because we're now living in an environment where the grants aren't going to be there. So the need to actually be spending out of our fund balance might be more possible.
The main things that I've always been concerned about here is multi-drug resistant TB case, although 7 TB cases is huge. So that, because
Are you
it
doing a
takes-
group therapy on them?
Mhm. And it takes a lot of money and time, and you know, you have to keep the people, you know, isolated and fed when they're in isolation, and sometimes you have to have incentives. There's all kinds of stuff that you have to do with TB. But the other one is a big foodborne outbreak in the county, or some type of infectious disease outbreak. Those are the ones that are concerning. Those are the ones that can just hit boom, and we will.
Or, you know, both at once.
You had
Or
something at
another-
the up and ran tool.
Yeah, Lincoln's Challenge.
Yeah.
Yeah, that was a big one. Norovirus.
What about measles? How are we doing?
We're still.
Not reported.
We get
Well,
we
it's
get
the same
occasional
reporting
scares.
system that they have for the county.
We're good. We're good.
It's all around us. If you
No.
want to know that, it's all around us.
Yeah.
Yeah, it is all around us, and we've had a few scares, but so far, so good.
Honestly, I wonder if the MMR outbreak in 2010 is protecting us because we had everybody lined up at the emergency to
Yeah,
get shots for
we,
that.
it absolutely did. I mean, measles is that's the stable vaccine. Measles is stable virus. That's, you have.
Pertussis is the one that.
Pertussis is the crappy one, yeah.
Yeah.
So, I mean, and also mumps. Mumps is not a great one. So those are the ones, and when we had that big mumps outbreak, I mean, my God, we gave thousands and thousands of
I
shots.
was lined up in the gym, and it was crazy.
Yep. So it was, that did give people extra immunity for sure.
And I'm sure we got plenty of people who hadn't been, vaccinated at all until then.
Well, I hope not, because U of I does a good job, they do a pretty good job of making sure people are vaccinated to go to the school there because of all the living arrangements and stuff.
Yeah.
Whereas Parkland doesn't do that because of, they don't have anybody living there. But still, it's still pretty good. The vaccination rates are going down,
Yeah.
but our county is still decently vaccinated. But there are some schools that are not in the protected range anymore.
In Big
Really?
End.
Yep,
Like
Through their
public
own
schools
volition
or
and
like
through their own.
both,
Right.
Are they in our county?
yep.
Well, do we have any power to actually hold them accountable?
No, but we do reach out, we just actually did reach out to them and say, hey, is there something we can do to help? You know, can we, because a lot of the kids, some of them are like McKinney-Vento Act, so they're homeless related issues.
So it's not a choice, it's just.
Some of them, yeah, some of them are a choice, but some of them are that, like they haven't had the time to get, they haven't had the resources or time to get in and do it. So with those, we can certainly help. And we've reached out to try to urge schools and just to tell them, hey, your school is not ready for an outbreak, so these are the things that you need to start thinking about now. Find out the vaccination status of your staff, make sure they're vaccinated, because if not, they're gonna be excluded from school for 21 days with measles.
Mhm.
That means they can't work,
And that's exposure, that's not even touching
and,
positive.
and who are you gonna have there? So if they don't know their status, they need to find out their status.
You're not getting pushback from schools saying, we don't believe in this.
No,
This
it's not really,
nonsense."
it's not really that.
Okay.
There are some that just have higher levels of, but, and in a sense, that's okay as long as the whole place is vaccinated up enough, but in some schools it isn't, so we're letting them know, if you get a case, this is going to happen, so start doing these things to prepare now, because, you better.
So when you do like the sports physicals or whatever, are you also offering vaccines?
Oh, yeah, we always offer vaccines. I don't know if we do it at sports physicals.
That might
They-
be.
That's a good idea.
The sports physicals, they went in and out of there.
Yeah, but how long does it take to shoot them up?
No, not very long.
Make it like the army, you just have to get vaccinated, we didn't even ask you. You just-
Yeah.
Well, I won't get into the complications of vaccination in this
So
world, but
Walk me through, what, if we move to 30%, halfway between 25 and 35, just to pick a number, what's that look like, and what's the connection then to the requests that we've been funding?
that's gonna take Travis. So what we
I can
need
take
to,
that question back, or you
yeah.
can email it.
What
Well,
we
that's
need
if
to
we-
know
if we
from,
kinda had a goal of
even if you
25,
did it,
35.
even if you got back to 25 right now, I think we would be, fine, psychologically fine.
His recommendations,
23%.
we're at 23, and his recommendations to
No,
build up the fund
it's just
balance
to
in
get it back up
FY26.
there,
The
so,
difference between 23.07 and 30% when it's 2.2 million is $152,000.
yeah. So, I mean, even if you got up over the 25%, you're still in the range that you've set. And
So, there's just a lot we don't, well, there's a couple of key elements that we don't know. And the one is our revenue.
Yeah.
that's
And
what
we
need
should have a
Travis.
projection on our revenue
Mhm.
by August.
Mhm.
What were we running in 23? That's a big jump in terms of the fund.
Yeah, this
balance.
is why
So there could have been a
I wanted to
revision.
get this history.
Yeah.
I'm a little surprised at that number.
So we
It
had,
might be
You mean
better
once
than
all that
when
money-
the county money
Yeah.
went in,
I guess.
Yeah.
so
I'm
that's
guessing that
when,
was ARPA funds being distributed.
correct. So, yeah, so that's when, and then that now, so some of that, as you see, we've got SIPA money, and then there probably still will be projected county money coming out of that too. So we had county expenditures go in, ARPA funds as we're talking about, and then some of that's gonna have to come down off of even that 162. So he's saying right now, we're at 510, and that puts us at 23, but we could actually go lower than that once we know what our final payments are with the Carl repayment, if any more comes out of that.
That should be known tonight.
Okay, so
That was what
that will
was
give us some additional
Yeah,
information.
That'd be helpful.
Right now, the 50,000 that currently is going to Promise Healthcare for dental services outside of their additional request for the 25,000 for recruitment of a dentist. That money is already in the general budget. So
So it's
what
already
came out of-
budgeted, it's already.
It's already
earmarked.
budgeted, that's
Yeah,
not
we
out of
just
the fund
typically
balance.
that's a
Yeah.
budget.
Just rubber
item.
stamp it every
Yeah,
year.
that is not out of the fund balance. Out of the fund balance was the 25,000 for recruitment, and then the additional 30,000 that I will let Whitney come up and do her proposal, that Whitney is gonna be proposing, that has come out of the fund balance for the last 3 years. So we've taken
And that's only 30,000?
30 and then 25, so 55,000 has come out of the fund balance last year, 55,000 the year previous, and 57,000 the year before that, in the last 3 years. And so we have been going down on it without like a lot more going back in. And so, you know, I think that's his caution to us now is, you know, we're now going below that 25, and it's again at the time that we just might need to make some decisions, and I'm not, you know, again, swaying one way or the other, you know, whether we partially fund, we fully fund, you know, it's just things we need to be aware of and where we're at in this particular time.
It's August that we'll make this decision.
We'll make the decision in
So-
August, but I wanted us to
We'll
kind of
have more
discuss it
information
now.
in August.
Yeah, hopefully we'll
The
know
agency's
if
like
things are
Yes.
getting cut or what.
It's, I would just plan for it anyway, because if they do it, they're not gonna follow any kind of rhyme or reason or be
No.
predictable or give you a warning or anything, it's just gonna happen.
So the proposals for promise are in your packet as well as their, I asked them for the last 3 years justification, so that's page 25 in your packet. Whitney is here, so if everyone would be ready, I would invite Whitney to come up and give her proposal.
But I'll come over here.
Thank you very much.
I'll be on
Thank you for
camera.
waiting.
Oh, of course, yeah. Amy, do you mind scrolling to it on this guy? Thank you. I need to give you a tech bonus. Tech wizard. So basically, I'm asking for the same amount of money, but I want to expand the different preventive services that we've offered to Champaign County School children. So in the district, we do teen pregnancy prevention education, and then we also do healthcare navigation and school referrals training for staff. And so that's what I'd like to offer into the schools, into the county. The teen pregnancy prevention education will be the same that we've done the past couple years. We use a program called Making Proud Choices, which was an evidence-based, age-appropriate curriculum for adolescents 12 to 18. We've been using that for 8 or 9 years now, I would say, both in the district and in the county. So it's medically accurate, developmentally appropriate, and it's delivered in a safe, honest, relatable way for adolescents. The other ones that we want to start, the first one is the healthcare navigation workshop. So that is basically, we offer it to young adults and to parents or caregivers. And it talks about like the importance of yearly well-care visits, how to make a well-care visit, the difference between a well-care visit versus a school physical versus, you know, an appointment just for an acute issue, something like that. How to navigate healthcare, health insurance basics, just basic navigation things that adolescents don't really have access to in your regular school curriculum. And then also we offer it to parents and caregivers of young adults so they can help teens navigate the healthcare system.
And you do this in the schools or?
Yes.
Okay.
With the kids, we do it in the schools, and then with parents and caregivers, we have like after-school sessions
Now,
or.
is this junior high you're doing this with?
This one's 11 to 21, so mostly it's junior high, high school. We like to focus on like the 17, 18,
Yeah.
leaving mom and dad's nest.
My daughter must have been sick that day because I'm still leaving her.
If they're leaving the high
It's
school nest or
hard.
something like that, we like to target that area of, you know, mom and dad might not be making your doctor's appointments for you anymore, here's how to do it, things like that.
And there's no resource like that in the schools anymore.
No, I mean, unless a health teacher is doing that on their own, which
There you go.
they are not. That's why they like to have us in there. And so in Rantoul, it would really be nice to have this because we could refer them right to the school-based health center in the school in Rantoul at Ader. So it's kind of goes nicely hand in hand. It's sort of an advertisement or a promotion for them. That's what we do in Urbana with the Urbana School Health Center is we tell the kids, you know, if you need these services,
Right down there.
right down there, hop on over. And then school referrals training is for staff in the schools that work directly with youth to be like an askable adult and help identify different services in the community where they can refer students and sort of be like a buffer between I'm your teacher, I wanna help you out, but I can't listen to, you know, your whole life story, trauma dump type thing. But actually give students resources to navigate on their own.
So is that just for mental health, or is that for any?
It's for anything, any type, we go
Substance
over.
use, mental health.
Yeah, substance use, mental health, if they're having food insecurities, it's basically teaching school staff, whether that's teachers or social workers or coaches or anybody really, what different resources are in the community that they can connect kids to. And it also has a significant section on what services in Illinois minors can access without parental involvement. So sexual health, there's some
I would
mental
be
health
curious
services.
If some kid says, I think I have ADD, but my mom doesn't wanna hear it, like,
Uh-huh.
you know.
Mhm.
Yeah.
Yeah.
So how to do that effectively. And then youth confidentiality, while engaging families appropriately.
Any gender issues, tell me what kind of stuff you do
Gender issues.
to prepare me for the conversations.
Gender issues is like if a
Reassignment.
child is saying they're having gender
Yeah.
questions about their
Yeah.
sexual identity or gender identity, we would refer them just to like the basic services in the community. There wouldn't be anything that like we would teach the school staff to like intervene on, but there are resources in the community, there's, I'm blanking on the name, Up Center, there's, other
Behavioral
resources that
health
people
places,
could,
Up
behavioral health
Center.
places that they would
Planned
be
Parenthood.
connected to.
That's great.
And like where to connect people instead of just saying, well, sorry, you're kind of out of luck.
We would refer them to the coach there at the school that actually does the sex changes there, which we
Yes.
understand happen.
Wait, what?
I'm kidding, that was one of the things that I heard, that
You'll get used to it.
the people were saying that their kids were getting sex changes at school. I'm like,
God.
okay, no, that's not happening, but, what? So, yeah, no, that was
Yeah,
just a
that's-
joke.
Yeah. that's-
Show up at the gym, 8
Yeah.
o'clock, we're gonna change your sex.
Yeah.
Walk-in zone. So that's just the expansion of the preventive healthcare services in county schools. So they all kind of go together. It's kind of a nice complement. Folks, the students can get teen pregnancy prevention education, referrals where they can go, and then on top of that, like healthcare navigation, both teen pregnancy services in the community or other healthcare navigation stuff.
How is this done in the cities, Champaign-Urbana schools? Is that funded by the schools?
It is not funded by the schools.
Funded by a grant.
It's funded by a grant.
So, okay.
And do the schools
And
have
we're
to
not
invite you
eligible
in,
for
or-
that grant?
Yes, we're like vampires, we must be
We
invited
must
in.
in.
But once we're in there,
We've had very successful relationships in the Champaign-Urbana schools with the teen pregnancy prevention program. We've been doing that since like fiscal year like 15, I think. And so we have good relationships both with teachers and with like the people that are over like the health curriculum at the schools. So we've had good luck getting into the city schools, Champaign-Urbana schools. And then they just kind of like keep inviting us back, which is great. And it's very nice to be able to tout that like all the Champaign middle schools and the Urbana middle schools are getting the same information as they enter high school.
Okay, and what's the grant from? What is the grant?
Illinois Department of Public Health.
Okay,
that's a
so
state-
they're,
It's a state
so
grant.
they, and, you know, this is a bad time to be talking about grant funding, but why can't we get that for the county?
well, there's a reason. It's because none of the county schools qualify, because it's based on number of, what is it?
Minority?
So,
It's
yes,
kind of an
40%?
aspirate, yeah.
40% racial ethnic
Now,
minority.
that's ridiculous. Who
It's
puts
the
that?
thing that
It's,
transcends.
you know,
I don't know.
limited amount of money, they have to make
That's
up
the
rules,
way
the
they
grants.
keep it.
What about the
That's how it
university?
works.
Because like those are the kids who are leaving their parents and then they're like trying to navigate the world and they're not doing a great job.
You mean, are we
Getting-
working with
getting
them?
constant-
That's
yeah.
McKinley's job.
That's technically McKinley's
I mean,
job,
they
yeah.
have they have a ton of resources there, they do a lot of this stuff.
Yeah.
But can they help?
Yeah, oh, you mean, can they
Like
help?
financially?
Yeah, with
Oh.
like this, like can the university
Maybe.
help?
So there are, possibly, but there are a lot of,
I think they'd be only interested in funding like university students.
it's
They're
not,
only
it's
gonna
not,
be
it's,
giving
I think it's earmarked, you have to spend it on university level stuff. It's not like it's just a bucket of money they can throw out like, over, it's like they gotta spend it for what they've been given it, just like
Wouldn't
us,
that be nice?
We're giving you for educating college students. Now, if they wanted to kind of improve a little have
No,
a
that-
summer camp
Or
for
college
high
students
school.
volunteering to build their little CV for whatever they
Yeah.
already have.
Yeah.
Well, that's interesting.
I just want to state
Then you
once
gotta
again,
pick
and
it
I've done
up.
it, I've done it 2 or 3 years in a row, is that 40% requirement just simply makes absolutely no sense.
It's all about money. It's just all about money.
They
They
have
might
to
change
limit
it to
it somehow.
50% at some time. They may decide that you have to have, who knows what, but.
It's based on racial, like,
Schools with at least 40% racial ethnic minority, and we use the Illinois School Report Card website to get those numbers.
So
Why-
white
why-
kids in rural areas don't have any of these problems then, is that the deal?
No, they do.
They
just-
absolutely have these
They
problems.
absolutely do have the same problems, trust me, but
So I've
it's
noticed
just,
a lot of the times they
Right.
define, by economic, socioeconomic, like you're 80% or more for your use of lunch.
Yes, that's just, this is an
This is
ID.
just not what-
This is the teen pregnancy prevention grant that we have is Illinois Department of Human Services. And it's a federal grant, federal use,
Oh.
federal, I don't know where. Office of
So
Adolescents out there.
where is that?
now the grants are probably going to be to start making kids have babies, get married.
That's
and
exactly
get married
right,
at age
yeah.
12 and start
The
making out
grant,
babies.
the name of the grant is the Personal Responsibility Education Program, so it's
Bless me.
nomenclature kind of, I think keeps it a little bit hidden, at least for now.
Yeah, it's,
Julie, we people over 60 have a different perspective on that question.
Yeah.
Which one?
To need to have more people born.
oh, yeah.
You just,
Oh.
now that you're 60, you say.
US is down to 1.6 replacement rate right
Yeah.
now. And,
And let's
stability
have-
is
and
2.1.
see what that's gonna be after another pandemic.
Or,
When we stop
And the
letting
racial
immigrants in.
driven thing has been keeping us growing now and such, and-
Well, this is a difficult problem because this is a good program.
And she's
and-
expanded it.
Yeah.
Yeah, and
But-
what she's saying there is you're gonna get more value for them. It's the same amount of money, but we're gonna get more services in there.
Yeah.
And why we're doing that is because we plan to, barring anything really significant, we plan to, after we pass the district budget here in July,
June.
Monday. Monday. We plan to let staff know that we're going to write it out for a year. So we're gonna keep doing our services for a year, using possibly some of our fund balance to do that if we have to, because we don't want to lose staff. Because, you start hearing about all these cuts and stuff, so we would like to be able to say we can do this for a fiscal year.
And healthcare.
Barring anything like bizarre
Yeah.
happening, which could happen.
And
at
healthcare
any moment.
navigation seems like it's moving in a direction of like a billable service.
Yeah.
Having community health workers.
2027, that's gonna be a billable service, so we need to keep our trained people
Yeah.
here until we can get them to that, where we can start billing for that, which will be nice.
So how is that going to become a billable service?
So the state is coming out with basically a training and a vetting system for community health workers. And then that healthcare navigation by community health workers will be a Medicaid billable service. If we still have Medicaid and.
Assuming we
FY27.
still, yeah. And it will be a billable service, and so will disease intervention specialists, which we have a lot of, because that's a big piece of what public health does.
Yeah,
So
communicable
we-
disease, healthcare navigation,
Right
and
now,
community
that's-
doula stuff.
You don't get anything for that, so that will help too.
How will that impact our budget with this then, when you get to that point?
There'll be money coming in.
There will be money coming into this program in the county.
Oh,
Yeah.
it'll be a, what, I'm sorry?
How much is covered?
We don't know yet.
Yeah, they don't know
It'll
that
be
much.
pitiful. It'll be pitiful, but it will help. Like
Yeah.
we get like.
Better than nothing.
Right, it's better than nothing,
Mhm.
because at least you're, putting
Now, are you
something back in there.
guys considering raising any of the fees that you just talked about raising for this budget for this year at all?
Well, we're gonna have to look at that, yes.
Okay.
So the fees that we have are almost all environmental health. Well, they are all environmental health.
Dental doesn't have any fees, we only see people that have a benefit,
Medicaid.
Medicaid benefit.
So, we are looking at that. We're
I was talking about
looking
for
at.
like, inspections and.
Yeah.
and
Yeah.
fire.
Yeah.
And we're looking at things that, so we have fees, we have grants and contracts, which we are always looking for more of those. And we will, but we're also not gonna take grants just because it's a grant. I mean, we have to start something else. So unless it's something that ties in with the skill level of people that we have here, that we'll be able to, you know, keep them. I doubt that unless it's something really massive, I doubt that we're gonna do that. We're looking at a Robert Wood Johnson grant right now. So we're always looking at grants, we're looking at fees. We have space to lease out. We may have more space to lease out, given that they just cut all of U of I Extension's entire FNEP program to do education for people with SNAP, which is an amazing program, and it's gone. It's been zeroed out of the whole federal budget.
Is that hasn't passed
No,
It hasn't, but that's what's.
it hasn't, but I hope they don't do it, but
Yeah.
I mean, big things are gonna go. So we have ways of getting money, and we've never gone to the community and said, hey, we need to look at our tax levy because we need to fund dental in this community. We've never done that. So we have
that
things.
has to go to a vote, or is that something?
Oh, yeah, that would have to go to a vote.
Yeah, then I have it.
Yeah, well, I mean, it would be things like that, but I'm just saying, we've never really done it, but there are things that we can do. We have bonds, but it has lots of rules attached to it, so it's just a bunch of different things that we're looking constantly to, can we maximize, you know, and what can we, and that's why I say we're thinking about doing that with the staff and the part of our fund balance because of the district side, because fund balance has a lot of rules attached to it too, so we can't, you know, we've got to be real careful with that, so. We're looking, we're constantly looking.
Only one. Are there other questions for Whitney?
But this is the kind of thing though that's so frustrating to me because
This is all preventative,
See,
and you know,
it's
if they're,
all
if they're really,
preventative
if
and-
they're zeroing everything out, and putting it all in Maha, I think you could probably make the case that this counts as.
it is, I mean,
It's
because.
just nonsense,
It is nonsense because, you know.
It is, but you know, if
What's
they're
the
gonna double
best
speak,
way
you
to
gotta speak
prevent
it
unwanted
back.
pregnancies, right? It's education and it's access to contraception. And that's how you do it. And so you take that away, you're gonna have a lot of more unwanted pregnancies
And STD,
and STDs
so we
and.
can properly show them our dashboard.
Yeah.
Thanks.
Currently Champaign
We're looking great.
County has no gonorrhea or chlamydia.
Look at us
It-
go.
We're trying to.
Look at us go. I'll be back in August.
Good job, good job, there you go. Way to
Working
go.
hard.
Yeah, maybe we just kept those off on purpose and be like, see? Trust me, the numbers are there, they're coming back.
The one thing, and this is a bigger issue, is like now with all of, because like, I don't know what the economy really is in Champaign-Urbana, but I hear the university is a huge source of that income.
Yep.
So now that we have international students likely declining enrollments, perhaps now with like this, with the student loans and like, I don't even know, I have loans, I have no idea what's happening with that.
Well, the international students, you know, a large part of the politics behind that was this infusion of Chinese paying full freight.
Yeah, they
And,
bring a lot of
and
money.
because the
Double,
state
they
wasn't
double.
keeping
You're the
up.
people driving the BMWs, the exotic
Yeah.
cars, like you can't get out of China unless you're very well connected to the CCP and you have the money.
Right.
And that's
And
like,
they knew that, and this is all part of the whole trade war thing, it's just who they're.
but it's literally going to affect
Oh,
like
it's
the
gonna hit
local
hard.
economy, and not to mention now
They bring in
people.
like $50 billion a year.
Yeah, and it's not even just about the Chinese students, it's about every international person, like everybody is like freaking out, like,
Oh, yeah.
and I mean, the reputation, so I wonder, I don't know, like, what is the hit gonna take?
We don't know yet, and we'll probably see in fall what happens. My assumption is they're going to defer,
Yeah.
so we'll have a lot of students deferring their acceptance for a year, during admission.
But
Like
I
they did with
depends on where they're
I
at in the
heard that we're
process, too,
expecting
'cause it's
60,000
just a new app.
enrollment this year.
Right,
Yeah,
yeah,
it's
so
just a new
I'm
app.
wondering if it's
But
gonna be a
that's just
delayed
because
effect, because, but then.
that's who's been
defer,
accepted, that doesn't count.
Oof.
So, and people who have accepted may rescind their acceptance, or they may, my guess is they're gonna play it safe, they're gonna defer it, they're gonna wait until the 26 elections and see
I
what
mean,
happens.
do you blame anybody? They could be sent anywhere at this
Yeah.
point.
Yeah.
It's absolutely crazy, it's really crazy.
Yep.
Yeah, sometimes I also feel like I don't think they know that international student pay that, like, double the tuition.
Yeah, they are getting grants from student loans,
You
and
know,
no, they're paying
I
for
just-
that.
Yeah, it's just crazy, I
They have
mean.
their own balances.
That's
Yeah.
why the university increased that enrollment so heavily, and
Yeah.
what the reaction that took place was out of the suburbs of Chicago,
Yeah.
who couldn't get their kids into the U of I because of all these foreign students.
Yeah.
So the U of I's response to that was to increase the total enrollment. So
Mhm.
we've got 20,000 more students here than we
When
had
was
8
that?
years ago.
When was that change?
That was about 8 years ago, wasn't it, Dave?
Yeah, I think we were stuck at about 40,000.
Yeah.
And then
We're
it went
now
up.
to
Now it's
It's
55.
very fascinating, because
Oh, no,
like
we're-
pandemic
we're more
too,
than that
like
now.
if you go
More
look at
than
the
that?
house prices,
Yeah.
like that, it's like nowhere, I don't know where else in the nation, Chicago housing prices don't do exactly what happened here, which made sense when people left the city, so like, and I've noticed since like the years that I spent 1 year in med school here, and then I went away and now come back, there's so much more development.
Yeah.
And I'm like,
Mhm.
where did this come from?
So,
And all these
honestly,
new
we haven't
developments,
had a
who are
lot
they
of
anticipating?
new development since about 2008 with the real estate crash.
Yeah.
There hasn't been a whole lot of like between like 2000 and 2008. We had stuff going up everywhere. Like they were sprouting up like mushrooms after rain. We had, and since 2008, 2012, I mean, we've got fields that like, they're half full.
Yeah.
They built all the infrastructure and they're finally starting to fill in houses for it, but they had just started in 2008 and then just ground to a halt for 4 or 5 years.
Well, it's a little hard to find a house now.
It's,
Now,
yeah,
like-
because they're not building them and now nobody wants to let them build because, hey, all my wealth is in my house and, wait until I sell my house and then you can start building again.
So we just had the presentation from Whitney, and so C is discussion of the promised healthcare proposals. So just redirect your attention to those. Those are items 25 to 32. And again, in the 25, that's the justification for what we've just discussed has been spent over the last 3 years. And then their proposal is to maintain the same request of $50,000 for support services. And now that $50,000, that is funding some of their hygienists, as well as supplies, materials, and direct care support services for individuals in the county. We've been very clear that those funds need to be allocated to individuals in the county. And then the other request is $25,000 again for additional dental practitioner recruitment.
Is that actually helping?
Well, that's what I was kind of getting to,
What does
because
that
I was
include?
very
Is that
confused.
just for like a sign-on bonus? Like, what is the 25,000?
So it's been advertising, sign-on bonuses. They gave them one $3,500 for moving expenses. Travel expenses to come in to interview was another $3,500. That included airline tickets, hotel, and meals. And they've done that for 5 candidates, so that would be times that amount.
Amy, can you put some of
And
that
then,
up? Could you put some of that up?
They gave a sign-on bonus to Dr. Song of $5,000. And so in a total in 2023, they give $11,000 in total for sign-on bonuses. And from that, Dr. Song and Dr. Saeed, my apologies, I might be saying that incorrectly. They interviewed 4 to get 1. And then in 2025, the additional $25,000, they looked at recruiting 2 additional dentists and 2 additional hygienists, 1 dental assistant, and they wanted to expand services. So they're spending approximately $6,000 a month on Indeed postings.
What?
So that $25,000 went to $6,000 a month on Indeed postings and marketing.
I mean, sign-on bonus, the moving thing, that's like lower than what like a lab tech would get from like call. I mean, so that's probably the issue, is that it's probably low, they're finding. But then 6,000 a month on Indeed postings, that's
Yeah,
like.
that's crazy.
So it's like the money is being spent to attract, but then the actual, but,
Incentives.
yeah, correct, but that would mean actually an expansion of that particular budget.
It's unfortunate we don't have somebody from there, 'cause it's,
They were invited, so, but I didn't know that Lisa had stepped down last week, I guess, so.
Oh, really?
Sure. Yeah, she's not there anymore. I'm not sure when it happened, but.
So are these people like promise healthcare, are they also able to like bill like private practice dentists? could they have a private practice as well?
So they're an F2HC, so they can actually, they're at a higher billable rate for services than.
And they're
than
full-time
the health
people, I
department.
think they're full-time.
Yeah.
The dentists are getting their student loans paid off like medical students do if they work in a qualified area. So this is a federally qualified health center. They get, I think, $120,000 of their loan reimbursed annually.
If they stay for X number of years.
If they stay for, is it 2 or 3 years? Yeah. So there's a money besides the salary they're making it is an incentive. And most of the time, once they finish that loan commitment, then they go private practice.
Yeah, and when I looked at 2024, we had allocated the funds for attracting dentists. I did note on there that they spent $2,500 for a dental director, and they gave $5,000 to a dental hygienist. So that was a little outside but again, we gave the approval for the recruitment of providers. And so I wanted more detail so I could provide that to all of you as we look to make further decisions on these expenditures.
So really, we need them here to answer all of our questions.
Yeah, we need to find out how successful this is.
Yeah.
I agree,
It's
I
Yeah.
agree, it's a great idea, but
Yeah.
this is set up to fail.
$6,000 a month, but yeah.
That's for, yeah.
And that's a friggin' website, I'm
Yeah.
sorry, I'm
Yeah.
not spending
Correct.
$6,000 a month on a damn website posting.
I know.
Put it on
Like-
Craigslist.
It's, yeah, it's.
Like LinkedIn.
Like, okay, so
or
if you
other-
guys are, when you found this job, or did we find you? Like, where did you look? For, like, public health?
Nacho, didn't you?
Yeah, nature
Yeah.
website.
Okay.
There was no,
No
I don't
Indeed,
think, no.
You even know what Indeed is? You've heard of Indeed? Yeah.
I know what it is, but I just don't think
Ah.
6,000 is
Yeah, that's crazy.
a month. I
Well,
just feel like
they have
that's-
3 FTE right now in September, so the very last line, because I did ask them to also tell me how many they had.
Mm-hmm.
Mhm.
So there are 3 full-time dentists right now as of this coming September
That's
that they will have on staff, which is good. I mean,
Yeah.
that's really good for this area.
Mhm.
And for them also with the dental hygienists that they
Yeah.
have, which she's saying they have two each dentist.
Oh my gosh.
So, again, you know.
Better staffed than my business.
Right, just speaking from me personally, between the two, one, looking at sustainability, because there seems to be a plan for sustainability with the previous proposal that we just received. Also looking at where we are on the fund balance. We are still giving $50,000, I want to be
Yes,
very clear.
Yeah.
We're still giving $50,000 to Promise Healthcare, that's already been in the general allocations. This isn't an addition, and this is specific for recruitment costs.
Yeah.
The expenditure, or the previous proposal with Whitney, if we don't fund that, they don't have the program. So,
No, I don't have a problem with it.
yeah, I mean, so
25.
I just want to kind of so
Yeah.
everybody's kind of clear on what we're talking about.
I agree, I mean, the 50,000, that's fine,
Yeah.
like this, though,
The
they have a lot of
25
things to
they're
figure
blowing
out,
up.
because this doesn't make any sense.
No.
One, they need to tell us, they need to justify to us what the payoff, what the value of it is, because obviously, if we're talking about building our fund balance back up, then we need them to say, or we need them to tell us, we're not gonna be able to fund this unless we understand what the downstream benefit's gonna be, I think is what we need to hear, and that's something we can't answer without them at the table.
Yeah, as it stands now, it's, I better hear a damn good story.
Yeah, 100%, and it needs to be, I mean, that's like 6,000 a month?
Yeah.
That's like, and you said like, well, the sign-on bonus was like $3,000 to $5,000, it's like you're
Yeah,
spending.
the year before up a little bit.
So, yeah, they have a lot of explaining to justify that part of it.
I'm going home to ask my dentist friends, I was like, where do you look for jobs?
Um,
Not a single one says frickin' Indeed.
Well,
Probably not, like,
Never.
there is probably word to mouth, and
Yeah,
it's
that's
also
what it
just
is.
like kind of looking, I mean,
LinkedIn, yeah.
yeah, and honestly, I think we need to take the advice of our county executive, and that, their department is telling us that, we need to look at the fund balance. So I don't know, I guess what I'm saying here is, I don't know we can fund both.
Yeah.
So I think the decision we're going to make, and, despite, even if they say, this is a dire situation, we need 1 more, we need 4, or, with the proposal what Whitney said, this is also, this can lead to STDs and, more, unplanned pregnancies and things. we're gonna have to make a tough decision, that's what I'm getting at, I think, because I don't know that we can do both again at 55,000. We might have to do one or the other, do half of each, I mean, I don't know, and I don't even know, that's a question, Julie, I have for you.
What?
If you even reduce the amount that Whitney's requesting, that's probably should have asked when she was here, my apologies, would she still be able to run the program, or is that the bare minimum needed to run the program?
Well, I think the difference there is, we don't have any data to tell us that the 25,000 we're spending with Promise is being used appropriately, but Whitney is telling us, I'm asking for the same amount of money and I'm doing these other extra
Yeah,
things
exactly.
in spite of,
Yeah,
not
yeah.
having
the
an
deal
increase.
with,
I just want-
the giving the money for, even for the dental services, I'll just put my 2 cents in, Dr. Peterson knows I've been dealing with this, for years, is that a lot of the, are they doing anything different with that?
Yeah.
Meaning, like, if you get 50,000, is it just like offsetting the cost? But when you look at that, saw a total of 50 kids outside of Champaign-Urbana. And you get a bill for them, and you get a bill for the extra services. So, I mean, I think they're just kind of in the same spot as we are right now. We're all just trying to get more staff in here. But yeah, that is one thing that we do get the bill for, even though it's not the best billing in the world. We do get a bill for Medicaid, especially kids. And,
So their proposal to spend the 50,000 this next year is personnel, dentist, dental hygienist, dental assistant, office support at $39,350. Fringe, 26% of wages at $10,231. So they're gonna spend $49,581 on personnel, and then dental supplies at $419. The extra $25,000 is for recruitment only.
And what is their total income that they're bringing in?
Yeah, see, that's the one thing that I don't have a real sense of how big that program is, and, so I don't have a sense on what our part of it is
They anticipate serving 246 individuals
outside the city.
outside the city in the coming year with that 50,000.
But how much are they getting from the schools that they're able to do? Is it free?
It probably would be very helpful to get a full picture of that dental department budget.
And have
City
a
and
narrative
county.
to it. I think that that's something that it may be cumbersome with programs, but especially for something like this, where if they're getting all this revenue, what are we actually contributing to?
Well, they're claiming they're not making it, and you don't make it on Medicaid funding for your services either, right? How far do you fall short? Did you just make it a percentage or something?
well, it used to be $1 million. We put in $1 million. That's why we couldn't go outside of Champaign-Urbana, because you guys didn't put into it. So we're using tax dollars to supplement that. But it's also something that if we try to take that service away, I think people will freak out, because it is the only.
So you
one
still
of the
have $1
only
million
things-
shortfall?
Not now.
Not
It's
now.
not that now. Now, we're in we came, do you even remember? Boy, I just had that information. We're still putting a good chunk into it, but it's come down a lot.
And
And if we
it's
can get
because of
fully-
Medicaid, expansion of Medicaid, is that?
No,
No.
with us, it had to do with an increase in, first it was Medicaid match funding that we were getting, and that was helping out a lot. And then after that, they increased the rates, didn't they?
Possibly, I don't.
Yeah, but if we can, dental is one of those things where you need to be fully staffed, because when you're not, you're just bleeding money. Because if we don't have enough dentists to, feed the hygienist to feed the dentist, if you will, then all that, the dentist not working is really expensive. But we also don't have like FQHEs and other places have, where it's like a real high production rate, but we are going to try to bump that up so that they're seeing more kids. But what we do have, which is really cool, is we have a really low no-show rate. And that's because we do a lot of case management on the end of it.
And it sounds like Promise is having a high.
They still have a high one, yeah.
They also have articulated on page 32 how the recruitment costs would be spent. $12,500 of the $25,000 would be spent on sign-on bonuses of $62,000, or $6,000 to be $250 each. And then the other $12,500 would be spent on recruitment cost, Indeed, at $6,000 a month to cover a portion of the cost of these advertising for dental positions.
Oh, the advertising there again.
So they're spending $12,500 on advertising and $12,500 on sign-on bonuses.
Don't the cops like offer $10,000 sign-on bonus? I thought I saw that. in the middle.
Prison guards were getting signed on, but we lost all our
So,
prison guards in frickin' Danville because of that.
So one thing is, what other external funding are they getting? Are they maximizing whatever?
I can't answer, I don't know.
That would be something I think, they should be able to present and talk to. If they're gonna ask us for money to run the core operations,
yeah,
then they
yeah.
need to show that they've been like optimizing, cause like, this is
Yeah,
ridiculous a little bit.
Yeah,
This-
I mean, I don't know, I can't say that, but I do know that in the past, they've written grants to like Children's Healthcare Foundation, so have we've gotten them, so have they. And we're working right now on a new dental health needs assessment. That thing should be coming out because we hadn't done one for a while, so, that'll have some information. One of the things that we found doing that dental needs assessment is staff found out, we got the list of Medicaid providers, for example, for Champaign County. We looked at that thing, and we looked at it and it said like, I don't know, 56 providers. Well, immediately the person doing it who worked in dental was like, that's bull, these people don't work here anymore, So they went through that and got it down to 12
Yeah.
actual ones. But what people
You
don't
talk about
realize.
dental providers?
Dental providers,
Yeah, it's-
that accept Medicaid.
Yeah.
So there's 12,
I'm surprised there's
2.5 or
Yeah.
3, work for us, and then the ones work for Francis Nelson, and then there's Familial Dental. Other ones don't. They might say they do, but they don't. So we're gonna get those, numbers cleaned up. Because those numbers are what places look at when they decide if we're eligible for a grant
Yeah.
here, or if it's like a denominator of all kinds of things.
Yeah.
And it's looked at for, different formulas all throughout the state, needs assessments, all kinds of stuff. So we have to have good data. So
Yeah.
we're going to, and it's the state's issue. And they're working with Senator Faraci's office, and they've worked with HFS to try to get that cleaned up.
Also providers, I'm sorry, like the dentist, like if you're in private practice, they do very, very, very well for themselves.
Exactly,
Like,
and they.
So if they can't even chip in and take out.
We've tried, there's no mechanism, there should be a
A
mechanism.
tax.
There ought to be. They got state funding to go to school, just like we did in medical school.
That-
And we're on call for the uninsured,
No.
as the lawyers are, as pro bono
Right.
defense, yet the dentists escape all of that. And
Yeah.
We've been talking about this for 25 years,
Yeah.
Dr. Peterson.
I mean, it was like from this,
But
when
nobody
they broke
seems
off
to-
from the medical community and they said, we're not gonna participate.
Yeah. And they've gotten away with it, but it should be something where if you don't take, 10%, then you get taxed more or something.
I agree.
It could be, it has to, we're just to the point now where we understand that it's beyond our control now. It has to be a bigger fix, it has to be a legislative type of fix, because we can't, nobody will do it. And when I actually, and this was years ago, when I was trying to get dentists to take some of the kids, I was literally told things like, if I take kids with Medicaid, then I'm going to lose my other patients because they won't want to come here.
Oh, man.
I know,
Can
and
we
I'm just,
levy a countywide, we don't need to get a state, let's do a
I'm just-
countywide, like, tax them.
well,
Like, that is
You
so
gotta pass
absurd,
it.
it
I
blows
mean,
my
I'm plenty of money
mind.
to lobby.
yeah, I'm just saying, these are the
Look like
kind
real
of
estate
things.
lobby did the last
I got the
Oh,
head
yeah.
lice thing, that they'll bring head lice into my practice. It's
Oh
like,
my
no,
God.
so it was a lot, and I tried to do education, but I'm sure I was seen as not a credible source to get, to say, no, you won't get head lice from this, or no.
And if you
It's
do, you're already
nonsense.
up there in that area, just treat it while you're.
It's like, when I retire, I think I'm gonna just get myself a van and go around and just do free head lice treatments if people need it, because they get so freaked out by it, and I'm just like,
Columbia
okay,
River,
this,
I'm sorry, it's just like, it's so
it's
ridiculous.
such not an issue.
And it's not anything, even private practice clinics, like my mom had a private practice clinic, she was a neurologist, like, come on.
But they will go overseas to do a weekend of dental, you know, and
Yeah,
that's.
because that's part of their vacation, and they can write it off.
Yeah. So again, this is why I'm saying, it's literally to the point where it's beyond what we can do. So it's gotta be a legislative fix or something,
At the
you know.
state level?
No,
It's gotta be at the state or federal.
It's pretty imbued. I mean, it's not as if the one time they did it, and now they don't. I mean, they just
No,
never have.
it never. And it's not that way in other counties as much. We are really.
Really, it's not another county.
It is,
How about how about
they all
Bloomington
have
Normal?
problems.
I mean, that's an upper middle class.
I would have to look to know for sure, but we can compare them, but it has, since I've been here, 30 years, it's always been an issue.
Oh, yeah,
And I'm just talking about kids. When you get to adults,
forget it,
forget it.
yeah. Yeah. forget it.
Because when you try to get any type of sliding fee scale.
Well, what's
or-
fairly new in that 30 years is you do have these chain Medicaid provider agencies that we didn't have before.
Part of the problem with that is, this is something that we had to root out, and it was a problem. Because these for-profit things, there's a bunch of them up around Chicago, they get in their vans, they come down to the schools, they do all the sealants that they possibly can, they take all that money, because that's an easy one, they get all that, then they leave. The point of that, all the sealants and stuff in the school, is to then get the kids into the dental home to get it repaired. There's no dental home. So we do have it locked down in Champaign-Urbana that we will go in and do all the kids in the schools. Yeah, because otherwise, they would, they go in there, they find out they have 20 cavities, and then they can't get in anywhere. Our sealant program feeds into our own dental chairs, so we know that they're getting seen. Or friends, or Promise Healthcare. And the problem that we've had with familial dental is people getting irritated and trying to get over here because they don't like either the customer service, if you want to call it that, or they have problems like the sealants fall off. And that's a problem, or the
Cheaping out on
fillings.
materials, yeah.
Stuff just isn't, they're trying to crank through so many so fast that things,
Oh, yeah.
so.
That's,
To answer the question.
And they have a
previous-
lot of turnover, I think. So,
We
what
want
was
to
the
go
question?
back to the point?
I just wanted to answer the question. So they do get additional funding from United Way.
Oh, okay.
I'm our worst
Promise
enemy in
Healthcare,
this.
so,
Oh,
it's
okay.
like
How much
It's
is that?
dragging out.
They didn't say the exact amount, but they said it was enough to support a dental team.
One
um, in the package.
Wow.
Wait, so
That's
agencies
not
are
bad.
not required to list out their entire budget when they're asking for money from us, of like?
We've never have seen the entire
Yeah.
budget. I would like to see the entire
I think
budget.
that should be a requirement. I feel like other agencies like the
I'd like to
DD
know,
board,
I'd like to know.
they
what
have to
the
like
rate is.
list out what are the agencies, where are their funds, like it's a full balance sheet.
Well, they're not counting.
No, it's,
Yeah.
No, but we are giving them money. and-
Yeah, no, absolutely,
Yeah.
and I mean,
And I don't think the 50 is at risk politically
No.
with our group. It's the 25 that.
Yeah, that's like easy challenge.
I think, making some decisions there. And my only question to answer yours before was, in case this group decided that they wanted to give some money on those recruitment costs, I just didn't know, like, if you split the two, what would be,
What that look like for Whitney?
yeah, what would that look like, just so we knew that answer too. Again, not our advocating one way or the other, but I think, will be something that we'll have to make a decision on in August. Those materials, we read through those on the packet, we'll come to have conversation. Do we know who's replaced, is Jennifer still there?
Mhm.
Okay, so we could ask Jennifer to attend the
Yeah.
August meeting.
And they have like a clinical services director and somebody over dental, yeah, we
So
could
we can-
get
we
some.
can ask
How about bringing their budget director in?
Yeah,
You could
and maybe
ask
give them a
them.
forewarning of like what it's they're about to face instead of thinking.
Yeah, and
like,
that's
this
what,
is
yeah,
awful.
so I asked, so they're aware, because I asked for all of these details.
Yeah.
Which, the expenditures and what they're spending on, so we can certainly ask
So
additional.
this was in response to
questions.
your request?
Yes.
Okay.
Yeah, before this meeting, so that we could have something to discuss, so we could look and see, knowing what we were getting for fund balance, knowing what was happening there, I asked both Whitney and Promise Healthcare, which are only proposals that we had received, to come to this group to bring the specific details of what those expenditures have been over the last couple of years.
And why do they make this meeting, that's also, that reflects that.
They were invited to this meeting, yeah, so.
And they chose not to come. Okay.
One person is no longer with as of last week, but both Jennifer and Lisa were copied on that. Jennifer Henry was the director, and Lisa was in clinical management.
This is a bad one, this is a bad
So,
meeting.
It's not a great look for an agency to not show up and be part of, you know.
We've had them show up with somebody who couldn't answer a single question, that's happened too. That's embarrassing.
Yeah, and I mean.
And I couldn't blame the person,
It's tough.
it wasn't their department.
It's it's an important issue, but like, they need, I mean, hopefully, I don't know how to communicate with them, but like, essentially, they need to kind of, what would be helpful is to not only provide us a full budget of like whatever they're getting, but also a narrative about like kind of what are their directions and how is this gonna, in a more detailed kind of manner, but yeah.
And I would love to see a time where we're able to say, you know, that they're doing so well that we just say, here's this is right here with WIC, you know, here you go, here's the dental clinic and all the stuff, and you just start providing services here. And,
Yeah.
yeah, I would love to be able to do that at some point, because they do get funded more, but they'll have to.
They get 3 times the Medicaid reimbursement.
So there it is,
than
like
a
how much
private
money do these
practitioner.
people need?
Yeah.
Like they, you know, I don't know, maybe I'm just speaking to like private practice dentists or whatever, you can charge an arm and a leg, really.
And well, you have to consider too that how much of that Medicaid is gonna get yanked in the next.
Yeah, that's a.
Well,
real
hopefully
problem.
not from kids in Illinois. That's the one I do hold out hope for.
But,
that in
you know, when you start asking Illinois to fund the federal piece of
No,
it.
I don't mean that in general,
Yeah.
just, well, yeah. But I think that, like the expansion, I don't think it was on kids so much. The kids that were getting them.
It was able-bodied adults, 18 to 16.
Yeah, that's right, yeah.
And
Who
again-
didn't qualify because they weren't single parents.
Yeah, but again, it's still a
But they're lowering
humongous
the-
cost savings to have them on,
Yeah.
what they say, able-bodied, what they consider able-bodied adults.
People who haven't been able to be declared disabled.
Correct. It doesn't always mean that
Well, they're putting this work requirement in too,
Yeah,
which is
it's-
problematic for many.
Yeah, I mean, and for some it isn't, but for some, it definitely is.
Yeah, they're
And,
taking.
and again, it's a good thing to have between jobs, or when you're in a gig job, and a lot of these jobs don't have insurance, you know, and they
Yeah.
are working. That's what I don't understand, that they act like people aren't working that have
Yeah.
Medicaid.
Correct.
And they are, a lot of them,
A lot
a
of them are
whole
working.
lot of them
Yeah.
are working a lot and still having.
Well, and there's $700 billion in fraud too that they're gonna clean up.
But then
I
they
wish.
got out the system to look into these checks and balances, and then they're wanting to, like, if you want to tackle governmental efficiency, which I agree, could the government be more efficient?
Yeah,
Of course,
of
right?
course.
I think the VA still runs on like MS-DOS is their EMR system, you know, I'm not even joking.
No, it's,
And I mean,
there's a reason.
but like cutting out key personnel instead of doing, I don't know.
Or
doing due
entire
diligence.
programs, I mean,
But this
it's
is
not.
this
it's
is not
just
about like
working,
trying to
it's-
make things more efficient.
No,
This is
no,
very
it's not.
targeted.
It's about destroying it to the point where you can
Right.
point to it and say it's not working
Dismantling
and cut
it
it.
through incompetent leadership.
It's sabotage.
So that the king can.
Anything else we need to do tonight?
This brings us to item K, public participation.
Oh,
We must
there's
say
a long
so.
list.
We
Please
have
take
to-
a banker's.
We have to say, public
Cue.
participation on non-agenda items. Do we have any public participation on non-agenda items?
Esther, do you feel compelled after hearing all you've heard? Okay, you're the.
Thank you, Esther.
The
Our
voice
next
of the people
meeting.
has spoken.
Now, we're not changing the next meeting again, are we now?
No, we had to change this one because someone was looking to speak, but we're okay, we're good.
Okay.
Next meeting is August 19th at 5 o'clock, and I will entertain a motion to adjourn.
Move.
Do I have a second? Moved and seconded. Any discussion? Hearing none. All those in favor? Aye. Anyone opposed? Any abstentions?
Don't go to the home on Friday.
It's being a non-substantive meeting.
Yeah, you said non-substantive. I didn't say non, I said there were a lot of good stuff on here. You
Yes,
said
it was.
non-substantive.
I know, I did.
If all three
Way
people
off.
watching at home enjoyed the wide-ranging discussion.
Yeah.
Have a relaxing summer, try.
And thank you, everyone.
Thank you.